Arthur L. Schawlow said, to do successful research, you don't need to know everything. You just need to know one thing that isn't known. Research is a robust technique to explore new concepts through proper observation and facilitate taking the right decision at the right time. Research is the backbone and the prerogative to quality work in the medical field. 3 years ago, the UG conference was organized in Dr. VMGMC Solapur, and we stand here today to continue that legacy. On that note, let's commence this event. And what better way to do so than to be installed by eminent speakers from all over the country? Let's begin with the inauguration. Medalium and Azygous Colloquium. The theme that our conference is based on this year is research-based learning. This academic fest started with various pre-conference events, workshops, seminars, quiz, competitions, and symposium, providing enriched learning and career-building opportunities that just cannot be found in local settings and static classroom curriculums. First, we had the research methodology workshop in which students learned how to do research and the basics of research. On 16th and 17th of August, students were introduced to a plethora of medical techniques and equipments like airway management, CPCR, ECG, IV line, laparoscopy, episiotomy, basic suturing skills, catheterization, etc. through a hands-on workshop. Practically every single day, some new innovation comes to fore, some new path-breaking study is published, or some new guideline is released. Each medical topic is spread across various subjects and different years of MBBS. The Vertical Integration Seminar, which was held on the 18th of August, provided a unique opportunity for the students of all years, right from the first year till the final year, allowing them to coalesce their knowledge and present a holistic picture, integrating all the new advances regarding their topic. The fourth day of the pre-conference event highlighted the theme of the conference. There is no better way to understand a concept than by practically utilizing it. Research was conducted by student participants, and they presented it through the means of a poster in a poster presentation competition. Students visited the hospital and gathered history and related information on a case of their choice, and they showcased it in the case presentation competition. A national level medical quiz, Diagnose, was organized on the 19th of August. Teams from pan-India colleges like KM Mumbai, VMGMC Ahmedabad, AIMS Rishikesh, Madras Medical College, etc. participated in a highly competitive environment. This magnanimous conference will give undergraduate medical students the chance to perpetuate education and promote skill development. The conference focuses on sharpening the skills, providing the ability to interact with peers, to try new equipments for the evolution of novel and locally relevant ideas, and the development of consensus in contentious areas, all leading to improvement in healthcare delivery and patient outcomes. All of this has a direct impact on our daily clinical practice, helping us to improve safety and patient care. Lighting of the lamp is symbolic to igniting the flame of knowledge and eternal learning. I request our judges on the dais to proceed with the lamp lighting ceremony.
आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते
Now let's now let's hear a few words from our respected guest. I request Dr. Kanikar ma'am to give us some inspirational words.
Thank you very much. At the outset, I would like to compliment all the students who have organized this medallion, the third conference, as you just mentioned, at the college. And I think this is really important to take research and such activities to the next level, that unless we have participation
Due to some network issue, Kanikar ma'am has disconnected.
I'm sorry that I'm traveling and it got cut in the between. To all the dignitaries on the dais, faculty members, the organizing committee of Medallion, and all the other students who have reached or yet to reach, I'm sure even those who reach later would be benefit by listening to a few words of grey wisdom that I can share with you. I compliment you for organizing this meeting, because Shubhasya Shigram, if you have started early, a job half, like well in time started, is already half done. A time has come when knowledge is doubling. Did you know, dear students, it's doubling almost every 12 hours. Artificial intelligence is threatening to replace normal intelligence. In such an opportunity and this timing, it is not enough to be able to know the answers. Gone are the days where we teachers and faculty members can just provide you information. Today, information is available even on Google, even on the website. What we need to do is teach you how to sift through the information and change it to knowledge and thereby wisdom when you apply that information. And all this is taught in your research methodology and ability to question things around you. So therefore, the time to give you fish to eat is over. We have to teach you how to catch fish. And if that has to be done, there has to be you, the important stakeholder. So therefore, when you come together and organize such a meeting, I think it's very important. It is important that we understand and learn medicine for its basics, physiology, biochemistry, even first MBBS subjects, your anatomy, when they are applied into your clinical medicine, you really understand it. Otherwise, learning procedures, learning machines makes you a glorified technician. If you have to be called a doctor, you have to be a researcher. You have to have a curious mind who can find solutions. Let me tell you, I was no different as you are as an MBBS student. And I envy you all today who have such opportunities that from your undergraduate days, you are exposed to these new techniques. We learned it much later, where research methodology was first time, where probably because we just had to find a p-value and we took statistics seriously as a postgraduate thesis. But thereafter, one realized that there was no getting away. And then applying this to everyday clinical practice became the most exciting part of my journey, whether it was finding solutions for small problems. Did you know that my first problem as a clinician was, and a pediatrician, we had no NICUs, we did not have high intensive care units, but there were small babies which had to be monitored. So did you know my simple innovation a temple bell and giving mothers an opportunity to sit in my corridor a special care baby unit, so that one mother took turn and rang the bell to call me when she needed that a baby was having apnea, or when later during dialysis, and knowing that the cost was so much, using simple innovations like keeping a peritoneal dialysis fluid bag wrapped in a sterile sheet above a radiant warmer so that it became warm while doing dialysis for a baby. I mean, these were simple solutions which one had to find, and all of us clinicians keep innovating. The importance is to do it scientifically, to document it, to share it, because any research, if it is not shared, if it is not published, and it is not peer reviewed, it is worthless. So we have to be able to share, and then it gets its due course, due diligence, and where people can use it, verify it, and carry on further. So therefore, the first thing that I request you all is to ignite that passion in yourselves, ignite a curiosity. Don't take things at face value. When you look around, see for small problems which need a solution. It could be in the form of a simple diagnostic test. It could be a need of a small innovation to give a therapeutic, to administer an IV fluid or stabilize it or take photography. I mean, and young minds are the best. If you know, the average researcher of, say, in a company like Microsoft is only in his 20s. So why are we different? People who come to do medicine are among the most brilliant minds. But somewhere we shut our mind to the possibilities that we can do more than our everyday. And like very correctly the MC said, that it doesn't come in your routine education, and you need to look beyond to be able to find solutions. Your new curriculum, which is a competency-based medical education program, does try to address a few needs of translational and integrated approach to training. But even that cannot be completed unless you learn how to find solutions, how to fix a problem. And for that, you need to diligently work at the bedside, see lots of patients, try and understand their problems, because research which happens only in a laboratory is and may be excellent, but unless it has a translational element, at the end of it, you don't feel the satisfaction. But if you've found a problem, you've looked around, you've talked to patients, you've handled patients and found, yes, there is a problem, and then put heads together and find a solution. The other message I'd like to share with you is research is not to be done alone. There has to be collaboration. There has to be groups. So whether it is, if you're finding a solution and an innovation, please go beyond yourselves, do interdisciplinary, multidisciplinary. And today the solutions need even more thinking beyond. Like you may need to talk to, computer engineers, you may need to talk to engineers, you may be able to find solutions by working together in teams from different disciplines. That is how you find the best solutions. So these are some of the small tricks that I'd like you to remember, and take this forward and get more and more students interested. You'd be happy to know that Maharashtra University of Health Sciences, to inculcate this spirit in you, has started the summer internship program, giving you an opportunity, and some of your students from your college did participate and get selected. Next year, we plan to take it even bigger, where you'll get 2 weeks of an opportunity, if selected, to go and work in an area, maybe in a specific research laboratory, or it could be learning nutrition, you're learning each other's interpathies, because there is nothing which is absolute. Treatment and well-being or caring for a patient, you need to keep your mind open and respect all other specialities and learn from each other. So you might want to learn a little bit of yoga, you may want to learn meditation, you may want to, so that you can use it for your life as well as other people, and then you would also be able to do research in that. So therefore, please do take advantage of the summer internship program. We're also increasing the number of student scholarships for small research, giving a grant of 15,000 per student, so that in your summer 2 months you can take on projects. So the call will come out. Encourage more and more students to take it up. And besides a conference, bring research and a thought of questioning and trying to find solutions a part of your daily life. It may be in any field. Once you know the tricks, once you learn how to do it, you will apply it everywhere. With all this, I'll end here and wish you all the best once again, and may you have great success in this conference, in attracting more students to join this mission that you have taken up of organizing this conference. But more than that, let it ignite the young minds to think beyond textbooks, to find newer solutions, newer avenues, and that may create you newer career options in the future. Thank you so much. God bless.
Of research and going for new opportunity. Thank you, ma'am. I request
Madam, good morning. First of all, I am very thankful to give your valuable suggestions, thoughts.
I can't hear you. Sorry, I can't hear you.
Madam, I'm audible. Madam, I'm audible.
Hello.
Ma'am, as a dean, I'm extremely thankful to you. Give your valuable opinions, suggestions to my students, who I think you will be a good role model to them, because we have seen you from your undergraduate days. I from VMGMC college. You were there in FMC, and the career as a student. Then you rose to the one of the third woman in the Indian Armed Force to be promoted to the 3-star rank, and also as a deputy chief of integrated defense staff medical. And now you are the prestigious post of vice chancellor. And with you, with your ideas, dedication, my students all over the Maharashtra state will be beneficial, and they will really excel in their research activities. And I hope with your valuable guidance, we will start as a lot of subspecialty course research, and you promote them. And thank you very much, madam, to give your valuable time to my medical college. Thank you very much.
Thank you.
Thank you so much, ma'am. Thank you, sir. I request our guest, Dr. John Ebenezer, sir, to come up on the stage. I request all the I would like to welcome our Dean, Dr. Sanjeev Thakur sir, on the stage. Dr. Sanjeev Shamrao Thakur sir, the Honorable Dean Dr. VMGMC, is an expert surgeon in laparoscopic endoscopic surgery and a specialist in bariatric surgery. He is a pioneer in his field, having an immense amount of experience in administration and teaching. Dr. Thakur sir took his laparoscopic training from various centers all across the country. In 1996, he became one of the first people to start laparoscopic surgery all over Maharashtra. He has performed the largest series of laparoscopy fundoplications in hiatus hernia in India. Till now, Dr. Thakur sir has conducted more than 90,000 open surgeries and more than 25,000 laparoscopic surgeries. He was one of the first people to conduct bariatric surgery in a government setup. There aren't enough words to describe his accomplishments. I request Dr. Sanjeev Thakur sir to enlighten us with his words.
Good morning, my students. First of all, I'm enlightened that you are doing a conference at the entry level of your MBBS curriculum. First of all, I thank you for you arranging this conference, and this will really benefit, encourage to care to look your views to the society. Among all, we have Dr. John. He is Padma Shri awardee, BC Roy National Awardee. BC Roy is topmost awardee to a doctor can get. He's with us, my colleagues and my dear students. The invitee you've called for the lecture have done their phenomenal work in their respective field. And such thing you've started in your career is really will help you once you go back to your peak, and will you look back, how were you in first MBS? When I was sitting in the dais, I was remembering my days of my undergraduate days. That time it was my medical education was like a schooling that time, that we used to attend lectures and the teacher used to come on a blackboard and we used to learn like that. Over a period of 30-35 years, the teaching technology is changed. A lot of things are available in your hands. A lot of smartphone, tablets, you can really go to the YouTube, you can go to Google and find out. I emphasize you right now that you have really worked hard from your first standard to first standard, and then you got the MBBS admission. As far as me is concerned, from my childhood, I was dreamed to be a surgeon. Because my father was, he's a surgeon, still alive at 92 years old, still seeing patients. And from my childhood, I used to go with him in OT, an operation theater. I used to see the intestine, and I wanted to become a gastroenterology surgeon from my childhood. Now, almost you, when we become a doctor, is by chance, by your hard work, you come to a prestigious medical college. And to be honest, there is hardly any difference between the different medical colleges. First thing I should assure, and you should not bog down, that you have come to the MBBS, where in a Solapur, it's a smaller place compared to Mumbai and Pune. I've been, my education been in VMGMC Medical College, Pune. Hardly is there any difference between the approach of the teachers, Pune and Solapur. It's your mindset. If your mindset is positive, you will definitely grow and you shine globally. And this is the first step in your life that you are getting a automatic communication skill. To be honest, as of now, communication skill has the first important, not a guideline, is a staircase for your success in the life. Because our success depends upon the communication skill. The way you have arranged this conference, how way you communicated such a big faculties, and they have come all the way. This shows that you have a better communication skill. And if you use this better communication skill in your life, right from your career, this first step is your starting point, I think you will get success. Because this communication skill on which your milestone, your success depends. And I hope you communicate with the different faculties. They are really stalwarts in their field, and you find your own role model in these faculties and grow up and shine this medical college. Thank you very much.
Thank you, sir, for those words and telling us about the importance of communication for a medical professional. I request all the dignitaries to please come on the stage. I request Dr. Dankare Ma'am, Deputy Dean and Professor and Head of Department of Pathology. Dr. Tirankar Ma'am, Professor and Head of Department of Obstetrics and Gynecology. Dr. Savaskar Ma'am, Professor and Head of Department of Pediatrics. Dr. Chaudhary Sir, Head and Professor and Head of Department of Radiology. Dr. Prasad Sir, Professor and Head of Department of Medicine, to come on the stage. I request our Honorable Dean, sir, to welcome Dr. John Ebenezer, sir. I request Dr. Tirankar Ma'am to welcome our Honorable Dean, sir. I request Dr. Prasad sir to welcome Dr. Tirankar ma'am. I request Dr. Chaudhary sir to welcome Dr. Prasad sir. I request Dr. Dankale ma'am to welcome Dr. Savaskar ma'am. I request Dr. Doijer sir to welcome Dr. Chaudhary sir. I request my colleague Shidhaja Lunawat to welcome Dr. Dankale ma'am. And I request my colleague Harsh Agarwal to welcome Dr. Doijer sir. We thank you all. Now I request all the dignitaries to be seated.
Bariatric is an approach of a surgeon to the students. Bariatric surgery is. I think it's actually. Okay. First of all, good morning, everybody. I thank you for the organizing team of Medalium 2022, hosted by Dr. VMGMC Government College, Solapur, 1st of 22. This will be really a feast for you to arrange yourself, your mind, focus for your personality development and success in your life. And lot many stalwarts are there during on obesity because I found, as in Pune, so my career started. Lot many patients come to my OPD for surgery, say for hernia, for appendix, for piles, and they were obese, obesity. And then I went through the literature and found that obesity is one of the killer, is what we call a silent killer, which ignites the blood pressure, diabetes, arthritis, and longevity is lessened or goes down below the mark. So how do we define? I'm not just what I have done it, and I expect you to do choose your path in first embrace. Maybe you go to any career, but try to go at the zenith of your career. Now, obesity means excess accumulation of fat. We find nowadays we go to railway station, go to shopping with the help of the stress, the pizza, because sitting all the time, you must have done for your entrance, sitting, just gulping your food, junk food, and study, stress. So all this factor leads to obesity, and we evaluate is body mass index and waist to hip ratio. Now, talk about what I'm going to talk about, not European standard, Asian standard. So anything more than 22, we start as overweight. The concept of 25 is also gone. And what we find nowadays, 50% of the population going in this era, you'll be a minimum is obese. See, go anywhere you see, the obesity is really taken. Now, these are the guidelines. The underweight is 18.5. We hardly get 18.5 is really malnourished. But we must think if your BMI is crossing 25, you are at risk of obesity. Just see yourself. Apart from your study, I think this is a time that you should take concept of your health as well. I remember I used to go to the gym, not gym as a weightlifting, but did my aerobic exercise. Still I know. From my 5th of age, I am doing exercise. My parents' motivation, taking care, and then I came to, I understood the health, because to stand for 10 to 12 hours, you require a mental and physical health. And I appeal that we have developed the good ground, and you should go to the ground and do something for yourself, not for the people. Now, we have morbid obesity is defined as BMI is more than 40 kg, or they have a 35 kg with presence of comorbid like blood pressure, diabetes, ischemic heart disease, asthma, osteoarthritis. Now, this is extremely important. The risk increases if the waist circumference is more than 94 in male and 80 in female. And hip ratio, waist to hip ratio should be desired. Men should be less than 1 and women should be less than 0.8. Now, this we should know. Obesity is an imbalance in energy intake and energy expenditure. You must know how much energy is required, how much calories you should take every day. I think if you take this habit from your childhood, you see you're just growing age. But if you take care of your health from your first embrace, I don't think there's an issue, because you've seen a lot of doctors are getting infarcts and strokes at the age of 40. We know the lot of pressure on us of your studies, then competition, patient-related stress, family issues, but you are alone, you have to face these issues. So take care of your health. See, the obesity is an epidemic, because we have gone, I don't know, you must be younger, 2-3 years, because we have seen COVID in 2020. The death rate was more in this obesity and morbid people. See, can't exercise, eat too much, gain weight, get depressed. It's a vicious cycle. You have to come out that cycle. Now, what are the causes? people say that we don't eat much and still we put on weight. So familial, genetic, gender, social, and psychological depression. There are two types of depression. One, with patient get depressed, overeats, and one person do not. That will cause anorexia nervosa. Now, this comorbidity is extremely stressing because we just don't check ourselves. If you, because I've seen that when you enter the MBBS and we go for we have done a mandatory pre-medical test, because if it is there, we can detect and treat it. So you can see endocrine diabetes, cardiovascular hypertension, then hyperlipidemia, coronary cerebral vascular insufficiency, venous stasis, common, then fungal infection. So these are the comorbidities. Now, person says snoring. The wife says, I cannot sleep because the husband snores. So sleep apnea, asthma. So these are the factors which run with obesity. Now, whenever there is a disease, obesity is a disease itself. So you have to give a treatment. So what are your aim? There are some aim when you treat obesity. Number one is comorbidity. You treat the comorbidities. Number two is quality of life. A person should be healthy and a survival life expectancy. If a person is obese, his life expectancy decreases at 20%. 20% is too high. So what are the advantages of weight loss? Please do not follow the modern diets which is available in Mumbai, Pune, keto diet. Do a normal diet and good exercise. I think you'll come down. Avoid the junk food. So weight loss of 0.5 kg to 9 kg is associated with its proven data. 53% reduction in cancer deaths, reduction in diabetes associated mortality, and 20% is reduction in mortality. Then survival increase 3 to 4 months for every kg of weight loss, improvement in severity of disease, reduced hypertension, insulin resistance, person feels fit and mentally active. Because see, from morning, I had 2 VCs. Then I did my exercise. I came with inauguration. I will deliver lecture, and I'll be operating 5 cases right now. So you have to be mentally and physically fit to take challenges. Now, what are your treatment goals? Number one is prevention of further weight gain. Because once you either give a medical line of treatment or a surgical line of treatment, patient, there should not be a weight gain. Weight loss to achieve a realistic target. See, 200 kg should not expect to become 50 kg in a year. So always there is you should have a realistic BMI pertaining to that patient. Long-term maintenance of a lower body weight. That's the goal. Now, these are the options available. Number one is always nobody will ask for surgery. Wherever you go, being surgeon, the patient comes to you in OPD, doesn't mean that patient requires surgery. So there are a lot of medications available that is suppress your hunger, dietary changes, exercise, behavioral therapy, psychotherapy, hypnosis, jaw wiring. Jaw wiring, we hardly do this practice in Europe, where person is compulsory eater. We hardly do all these things. Unsuccessful at significant or sustained weight loss is extremely important. So after medical treatment fails, number one, our patient demands that he needs a surgical correction of his obesity. The bariatrics is the branch of medicine that deals with the causes, prevention, and treatment of obesity. Bariatric surgery includes a variety of procedures performed in obese. Now, what are the indications of surgery? When do you advise? Number one is we have modified our own data So we are advising the surgery from 28 to 30 with comorbidity and more than 32 without comorbidity. What are the exclusion guidelines? One is patient is truly unfit. For that patient, we put a balloon. So options are available. And balloon, there are a lot of balloons have come in the market. And with that, put a balloon in, that is called an intragastric balloon. That will also cause almost significant weight reduction, and the load on the heart and kidney will go down. So women who want to become pregnant within the next 18 months and history of substance abuse and untreated major psychiatric disease, that too we have operated patient. So whenever we do this bariatric surgery or we call it a metabolic, patients are unfit. So we have to evaluate them. One is staff evaluation and one is a laboratory evaluation. So we have a biggest OPD in Maharashtra where there is a dietitian, psychologist, nurse, surgeon, support group. This is the list, but we hardly do malabsorptive procedure more because the Indian scenario cannot sustain that malabsorption and they land them in cachexia. So we, according to the patient, we advise them a surgical option. These are the instruments are required, or we say armamentarium in OT. We have a modern OT. We are coming with a modern OT in couple of months. Should be voice controlled modern OT. Should be one of the first kind in Maharashtra. These are the long extra long trocars where there is hardly, otherwise they will not enter the abdominal cavity. This is the commonest procedure where we make the stomach as a banana. So two things are in this. Number one, the fundus is removed. After taking out the fundus, the hormone called ghrelin, which is a hunger originator, is out, and the stomach capacity is reduced, and patient loses weight almost 20 to 25 kg in a year. These are the port sites. These are the different steps what we follow. These are the modern gadgets. We cut and suture the stapler. Previously in Australia, people used to do open bariatric surgery. This is our OT setup, what we do it. This is a staple line. This is also gastric bypass. When the patient is of 35 BMI and patient diabetic, we do a gastric bypass. Now, what are the possible side effects? You must know, because patient is going to ask you this question. What will happen? So the patient may have some nausea, vomiting, gas bloating, dumping, temporary hair thinning, and some psychological changes because he was looking 120 kg, now looking 100 kg. So changes in bowel habit. But these side effects are tackled. You have to take the patient confidence. So better communication skill is extremely important. For every step, never use a lift to go upstairs. Always use a staircase. Same with the communication is extremely important in your life. Always in any disease, this multidisciplinary approach in your life also. But now, in your childhood, your parents supported you. Then when you come to a professional college, your teachers, your colleagues, your senior colleagues will teach you. You approach them. It is like a multidisciplinary approach. And whenever the patient comes to you, the initial contact, because you have to introduce yourself. You never say, when a patient comes to you in OPD, or your friend, call him by name. If you call the person by name, it gives immense confidence of that person in you. You don't never have that government approach. Always be a polite, sympathetic to your colleagues, to your teachers, to the patients. So we always give them pre-operative information, what we're going to do. We evaluate him, what type of surgery we're going to do, what type of things can happen, because you have the consent. Patient should not say, why have you didn't inform me? So what we call informed consent. And then a post-operative follow and support. The patient needs support. You go to your PG, you get depressed because in third MBBS you study only, sit in the room, and then you go for your PG, you're exposed to the patient, the stress, the patient, the work, you alone working day and night. So you need a support. So always make a good friends. Then you can share your views and come out. Don't get depressed or bogged down with these issues. This is my dedicated team with the surgeon, the registered nurse coordinator, registered dietitian, psychologist, social worker, exercise specialist, insurance coordinator if it is required in the private sector, and administrative assistant. Now, this is extremely important for you also, because you might be eating food outside. Always take some vitamin minerals in your daily habits. Enough of protein supplement, whatever is available. Don't expect to buy an expensive protein, but things what we in Indian food we take, you have a good amount of proteins. Take some vitamins, fruits. Now, what are the patient responsibilities? Your role before surgery, always, wherever you are approached, not for the surgery, as a you want to become a good doctor, good human being. So your role is defined in your MBBS curriculum also. Commitment to improve your health, diet, exercise, mental health. These three things applies to you as well. That doesn't mean that you are obese, but this will carry for your lifelong. Discuss your health history with your surgeon. Ask questions and vocalize. Ask him to speak. You don't speak. You just initiate, the patient starts speaking. And commitment, follow all the instruction on nutrition, activity, other care after surgery. Now the conclusion. Bariatric surgery or a metabolic surgery, effective means to achieve clinically significant permanent weight loss with low rates of complication. This is what we posterior specimen looks. This is a cartridge, what we see. You see this, we can treat associated umbilical hernia in the same sitting. This we operated 1 month before, pre-op 145 kg, post-op. Can somebody play the video? You see, he is jogging and he's lost 45 kg in 1.5 months, almost 1 month. This is the result. Only bread earner in his life, and he'll come to near normal after 1. So this is the results what you get. This is a patient we operated pre-op 155 kg 6 months before, and this was a patient. And now he just came to me yesterday. He is 90 kg now. You see the way he's walking. He was not able to walk, dyspnea and all sort of thing. This is really the benefits of obesity and metabolic surgery. This is what a glimpse of your surgeries we perform. Super 192 kg, the highest ever we operated in this institute. And can you see the liver cirrhotic? The 20 years old boy. We had a liver cirrhosis and he was extremely obese. And we operated here. So that everything is possible. It is not a question of the city. If your mindset that you want to do it, can you see this vessel? These are really portal hypertension and large varices. Can you see? You will once in lifetime you will get such scenario in such patients poor boy, 22 years old, and liver cirrhosis. You will, if you are interested in developing your surgery, we will be doing a Facebook Live. There you can really attend, see, and ask us the questions also. So this was absolutely a bloodless surgery. Can you see with the modern gadgets which are available in a government sector? In we have got in our institute should be one of the finest armamentarium in Maharashtra state. So we are way ahead of the private sector as of now. Can you see this? The modern things available, and this stomach is really mobile. It's very risky if you make mistake, because no mistakes we can't afford. You can't open and close it. You have to be so methodical that there will be little error. Any small error, a patient will be proper way of handling your tissues, and less handling is extremely important, because it's always a one go, because you cannot change it again. Once it's fired, it's fired. So you have to be pretty sure that when you do this is an automatic stapler gun. You don't have to just put it's like a trigger. You just put your finger on trigger and it is fired. So these are the linear cutter available in our institute, and we do this surgery on it. If it bleeds, it causes a liver clip. This is the third stapler fired, and we take out the stomach's specimen. A small amount of oozing will be there because of portal hypertension. We do after stapler, we do a leak test. It's extremely important. We give a methylene blue, a thorough wash is given, and with a drain, because you exercise the specimen. It's always safer to give a wash. We put a drain, comes out, patients start early after 6 hours. This is the 180 kg person. We did a mini gastric bypass because he had a lot of comorbidities. This requires a long learning curve. But then as the experience goes, we have already done it. And you will also learn, if you come to operation theater, you will learn these things, and you will really get an idea to bear to start your career in any branch. But I expect you become a good stalwarts in your future. This is what we exercise the stomach half, and then with the modern gadgets, this was a 170 kgs. Now the patient is 65 kgs. Is free of diabetes and hypertension. Whatever we have operated till today, there is no death. Number one. Number two, the comorbidities, they are absolutely gone. Patient is diabetes, sugar free, diabetes free. Hypertension is out of medications. Early liver changes were there, kidney changes were there. They are all doing good. This goes to our team because there are a lot of good communication, and we developed a confidence in the patient. So even if I don't pick up the phone, our team members pick up the phone and advise them any issues with them. A proper support is given. This is pinoidal sinus is an entity where there is an infected sinus, hair growing sinus on the sacral region, and is one of the notorious condition. Previously, we used to excise it, and the wound took 3 months to heal. Then a lot of flaps have come. People in India are also doing, again the recurrence. But with the laser, what we are doing it, patient is going home and we are doing under local. This is what machine we have got, and we are almost doing most of lasers, pineal sinus, Fisher Nano. See, this was a condition of this patient. Can you see 1, 2, 3, 4, 5 opening? And this was the secondary sinus. So actual laser application, and this was the immediate post-op, and this was the thing. Otherwise, normally we excise this much, or we make a flap and close it. And can you see patient immediately walking under local? So, and patient, I don't have photograph, but the sinus is healed in 2 months. This is a laparoscopic E-tape repair. Now, for a hernia, you know, you learn. So, any bulge in the inguinal region, this is your in first MBBS, as you go, you will learn slowly. So, the laparoscopic E-tape repair is a gold standard. Nowadays, this procedure is a gold standard. All over the world is followed. Can you see the translucent layer? This is what a laparoscopy tells you. There are 2 layers. We never learned, we learned a translucent single layer. So in anatomy, you are learning, these are 2 layers. Can you see this is superficial layer and the deep layer? And this is a mesh. We have, can you see the mesh? The double hernia were done, and the best meshes we are. This is a gold standard today for a laparoscopic E-tape inguinal hernia. Can you see? If you do an open appendectomy, you take a McBurney or gridiron incision, and you find the this. Can you see this liver? So it was below the liver. Can you see? So subhepatic. Sub is below. So because of laparoscopy, you can really do a good job. Again, this is the video of laparoscopic appendix. This is a specimen taken out, and patient walks home same day or next day. Can you see this? This is when you put in a scope, you can see the hernial sac. Can you see the testes inside? That is called as hernioscopy or a sacroscopy. You can see and you can really verify what is the contents in that. And again, can you see this is a mesh we have put, and then we'll suture the peritoneum. That is called as laparoscopic transabdominal pre-peritoneal repair. This is a fundoplication, a hiatus hernia. Always you bring the stomach from the behind esophagus, and we do a shoe shine maneuver. Can you see this? A classical shoe shine maneuver. This is what as a floppy niscence or a partial fundoplication. But this maneuver is extremely important. Now, whenever we put a graft inside, we have either we put a glue that sticks to the parietes, or we do tack with the tackers that fix it. But best and cheap is safe. That is what we call as intracorporeal suturing. With the help of Prolene, this really requires a lot of efforts, skill to suture this. Can you see this? So this you should learn. So what is 3 things you have to follow? Learn what I learned. Then the new technique. So I unlearn myself. And then I'm relearning. So this you should follow in your life. I think you will get good success. Can you see the skill? This is what you are suturing with the help of. This is a laparoscopic cholecystectomy. This, can you see? This is a ruveus sulcus. Can you see this? You must know. Then you should know the callot triangle. And this is what we cut the cystic duct. Can you see this? This is the tie. Never you clips because it leaks. And this is a CVD. This is a stomach. This is called a ruveus sulcus. So whenever you operate above, you will not do a biliary. Why? What is important? Gallbladder surgery. Number one, we don't want a biliary because there is a lot of anomalies are there. So we do not want any injury to the common bile duct and vessels. So you must know what is Calot's triangle. These are the commonest thing we comes with the piles, bleeding piles. Can you see this? This and patient goes next day home. This is what the procedure. These are available in our institute, doing free of charge, and patient this is what we first step is to dilate, because you have to insert the stapler. Now this is a anoscope. You see this. So this has to be fixed with the help of whatever the non-available suture. And otherwise, you have to do a surgery above the dentate line. If this slips, you might fire a stapler. Dentate line is very sensitive. You must know the anatomy of the anal canal. We perform the staple surgery above the dentate line. That is painless. And open surgery, what we do is below the dentate line. So that is really painful. So to have a success in this surgery, you should do a proper fixture of the anoscope with the help of non-available sutures. The key to success is a pursing suture. It has to hold the mucosa and hold the stapler gun. So this really required a bit trick, the experience, and it is done almost, and the patient doesn't have much of bleeding, and it's almost a painless procedure. This is a stapler gun which you fired after taking a bursting. You will not understand. This is your outlook that the treatment patterns change, and it is performed in our institute. This is what is firing has been done. This is our team. It's none of us, including me, ever do the great things, but we can all do small things with great love, and together we can do something wonderful. Saint Mother Teresa. Thank you very much.
Thank you, sir. Sir rightly explored a highly prevalent epidemic like obesity, an apparently harmless disease which affects a person both physically and psychologically, further highlighting the importance of bariatric surgeries in today's times. So educated us about the intricacies of laparoscopic surgeries on treating the various gastrointestinal ailments, igniting an interest in surgery and its skills. Dr. Thakur sir has been through an arduous journey only possible due to his dedication and perseverance. His knowledge knows no bound. Sir, we are very grateful to have the opportunity to learn from you and to witness your intellectual seminar. We have learned tremendously from you and wish to continue to do the same in the future. Thank you so much, sir. Now we would like to hand over the mic to our colleagues, Mehak Agarwal and Omkar Bhosle.
Now, we are honored to welcome Dr. John Abensar sir as our next guest for the upcoming session.
Dr. John Ebenezer Sir is the first orthopedic surgeon from Karnataka to have received the fourth highest civilian honor of the Padma Shri Award. He is also honored with Dr. B.C. Rao National Award. He is known for promoting holistic orthopedics, the West meets the East, which is a practice combining modern medical techniques with yoga for the management of osteoarthritis of the knees and other chronic orthopedic problems. Also, he is a recipient of the Rajyotsava Prashasti, the second highest civilian award of the government of Karnataka. He is an internationally renowned orthopedic surgeon, author of over 200 books, and holds 8 Guinness World Records.
So now, I would like to invite Dr. John Abensar sir on the stage to further glorify our event.
Thank you very much for those kind words. It is a matter of great pride and privilege for me to be a speaker in this unique conference which I am witnessing here. It is for undergraduates, and as a professional, I have been touring across the world doing so many conferences, but it is mostly for professionals, senior doctors, and postgraduate students. But here, it is for you people, undergraduates. When Harsh invited me for this conference, he gave me 3 options. One was to conduct a workshop on orthopedics, because I'm an orthopedic surgeon. So putting casts, splines, or how to put a sling, or how to do an intra-articular injections, I could have done a one-day workshop for you all, because that is my profession. Then the second option was to speak on holistic orthopedics, which I have pioneered, incorporating medical yoga into medical management, surgical management in orthopedics, paving way for new, unique, non-orthopedic, non-surgical treatments. And the third one was to give a motivational talk to you all young students. I picked up the third one because the first one can be done by many, and even the second one can be, maybe sometime later. But what I felt very necessary was to speak to my young students, the kids here, about how to become a successful doctor. So I thought this is one topic which I would definitely like to share with you all. So thank you very much for inviting me. I thank the organizers of the third Medalium of Dr. VMG Medical College, Solapur, for this invite. I have some Solapur Connect. Dr. V.M. Iyer, who is the doyen of Indian orthopedics. He has got his Iyer Orthopedic Center in Solapur. So he is a very great mentor of mine. So it is with great respect I come to this city. I'll be visiting him after this program. And his son-in-law, Dr. B. Shivashankar, he is now managing the Iyer Orthopedic Center. And he was the past president of the Indian Orthopedic Association last year. So these are my friends. He is my colleague, in the sense he was my junior, 2 years junior in my undergraduate days in Karnataka Medical College, Hubli, Dr. Shivashankar. Third, Dr. Kusum, who is working in Ashwini Rural Medical College here. She is a classmate of my daughter-in-law, Varsha, from Mysore Medical College. She has her mother-in-law here, Janabai. She is from Solapur. And, she'll be coming to this conference. She thought my lecture is at 3 o'clock. But I texted her saying that my lecture has been preponed. Mostly she will lose the lecture, and also she will lose an opportunity to see her mother-in-law, her husband, and herself on the screen here in VG Medical College. Right. So she is my patient, her mother-in-law. So these are my Solapur Connect. Beautiful city. I was just driving down the city. Very nice. And I really feel very happy to be here. You all here have chosen the medical profession. The question is, why did you choose it? What is your reason for choosing it? I am in love with white apron and stethoscope. Apron hugs me all the time, and death always stays close to my heart, as told by Pranita Nayak. Was that the reason why you selected it? Or because health career is one of the best in the world, because whether it is a doctor, nurse, pharmacist, the noblest job in the medical field is to be a doctor. It is the priciest health care career to attain. It is not easy to become a doctor, not cheap also to become a doctor. Huge time and money is invested to become a doctor, and it pays dividends to society. There are varieties of specialties, which itself is a rewarding life. You saw the bariatric surgeries now, such a rewarding and such a exhilarating experience as a surgeon. And in addition to patient care, we get to train in academia, research, what our VC was talking about, or both. Most importantly, the Hippocratic Oath is an example of the strong intentions to make a difference in this health professional. What it meant to be a doctor then, driven by service, principles, and humanity, is Dr. B.C. Roy. The driving force then was mainly service. What is the driving force now? Good life, status, money. Money versus service. Majority desire the former, but emphasize the latter. We want money, but we are, emphasize that we are here for service. How many medical colleges are there in India to make us realize our dreams? There are various numbers. One number is, as per 21 May 2020, there are 542 medical colleges and 64 stand-alone PG institutes in India whose qualifications are recognized by the Medical Council of India. The demand versus supply. 8,70,075 number of students who cleared NEET in 2021. Out of this 8,70,000, 90,000 got medical seats. That is the number of medical seats. Around 1 lakh of seats we have in India. There are 19.2 applications for a single seat in India and 6.1 seats for 1 lakh population. You can imagine how privileged you all are to be in this institute, to do this medical course and become doctors. We have 68 type of specializations for we doctors to choose from. Maybe orthopedics, pediatrics, you name them. There are 68 different types. Success as a doctor for you all these years, this has been the secret. Now it is no longer the case. What is the success to become a good doctor? Do your MBBS, then go for post-graduation, then do fellowships, then branch out into super specialties, then seek for a job or start your practice. Some people go abroad. What do we all aspire as a doctor? Well, everyone wants to settle down, have a good practice, earn well, raise a family, have house, car, travel, luxuries, comfortable and happy life. That's what all are dreaming here. We are trained to be good doctors. Such excellent medical colleges train you people to become good doctors. But we are not trained to face the harsh realities of being a doctor. What are those harsh realities a white apron carries? We are all dreaming of a good life. We are not prepared for this. Long working hours, emotional work, no work-family balance, multitasking, high responsibilities, critical decision, poor social life, fear of failures, increasing competition, difficult patients, and workaholics, being admired. We become victims of burnout. We burn out. It grows gradually on us over time. Perhaps beginning in medical school or in residency, we become disillusioned. We become cynical. It becomes very difficult for us to do a competent job. Stuck with 4 Ds, depression, divorce, drinking problems, death by suicide. We become a victim of the 5th D. We become desperate. Then finally, we get disillusioned with our choice. We go on strikes and we roam the streets protesting. So young doctors on strike. So life at crossroads for we doctors. Which way to go? This way, that way, where to go? And we face peculiar problems as doctors when you come out. Life is not what it appears to you when you're in a college. Life is so rosy here, so dream joy. But once you're on the field, your life is totally different. You face some peculiar challenges. What are they? Rural service. We are asked to go to the village and serve. What happens there? Poor working conditions and very poor salary. No other professions, whether it's engineering, IAS, lawyers, have this dilemma of doing compulsory service in rural India. And to do work in rural India, you may be the best brain here, but once you go on to a rural India, none of your intelligence is going to work there. What works is totally different in rural India. Poor salary. How much we earn as doctors? See, this is one slide which shows that in a medical college, if you spend 22 lakhs to become a doctor, you will end up earning 7 lakhs per annum, maybe on an average. These are average figures only. So poor salary, pathetic to say the least. Unemployment among doctors, plenty. You will not find enough jobs for you people outside. And then long working hours. Typically, you work for 40 to 50 hours in a week, and lack of sleep and long working hours. Poor working conditions. You stay in hostels which do not have enough facilities for you people. And doctors of today are forced to frequently switch their professions. So many becomes IAS officers, so many go for some other allied subjects, and some people take up into managing. They become administrators. They switch the professions. Why? While we struggle to make it, there is an easy backdoor entry by Ayush doctors. We are facing the challenges now. All the young medicos here are going to face the challenges. There are 7.7 lakh Ayush doctors in India. They will be right at your throat when you are on the field. So that is what is the challenge. And the National Medical Commission, which earlier it was Medical Council of India, comes out with various codes which are frequently changing, and this will unsettle a doctor. We think of so many things, but MCI comes down on us heavily. And we need to wake up to the harsh realities. How does India treat its physician? The patient is dead. Let's beat the doctor and go home. Workplace violence and humiliation is a unique job hazard for India's medical professionals who seem fair game for people, politicians and police. How did it come to this level? Why are we being beaten? We are the people who serve the society. We are the people who save the lives of people. Why is that we are being beaten black and blue? How can we stop this? And what will happen if it doesn't stop? What will happen to these young people here if they get assaulted on their workplace? What will happen to their morale? What will happen to their psychology? And it has got a far-reaching, far-fetching consequences. Violence against doctors has reached epic proportions. Who is responsible for this violence now? Very disturbing and scary visuals. We have not become doctors to face a situation like this. It is the worst nightmare for all concerned. I'll be elaborately discussing about violence of doctors towards the end of my talk. And then, apart from violence, the stress a doctor undergoes has emerged as the biggest killer among medical professionals. The lifespan of doctors have come down by 4 to 5 years when compared to the normal population. Is it not a paradox? A doctor who is supposed to save lives is living less. His lifespan has come down. A recent survey by IMA has shown that 80% of the doctors in India are stressed out in this profession. 80%, not a small number. 56% do not get good sleep. 13.7% face criminal prosecution. 82.7% stressed out. 46.3% fear violence. 24.2% fear being sued in the courts. 62.8% of the doctors surveyed are unable to see their patients without any fear of violence. 57.7% have thought of hiring security in their premises. This is a scary statistics. Well, with these challenges, is there a set formula for you all for success? Our curriculum is woefully inadequate. It has not changed since my time. I did my MBBS in 1979, and these are the very subjects I studied. This list I got from Harsh. I asked him to send a list. I wanted to know whether there is any change in the medical curriculum. No, 19 subjects I studied, 19 subjects you are also studying, but there is a sea change in the present practice. The times have changed. And what are in this scenario with this 19 subject? Can we dream? Can we have vision? What is our goal? How to take suitable actions, and what is the success rate? You can see the pyramid, inverse pyramid. Success is so minuscule now. Success as a doctor, not just with these now. We need much more. MBBS, PG, fellowship, job practice abroad is not enough to become successful. We need certain extra things. Apart from our medical curriculum of 19 subjects, we require 5 non-medical skills and 10 additional skills to become a good doctor. What are those? It takes to become a successful doctor with these 5 extra skills. You have to possess this. One is marketing. Second is latest knowledge of the software. You staying up to date with the progress in the medicine. Communication, which is very important. As our dean said, communication is very important. And convenience. How convenient you are going to make the life of your patient is very important. Very important tool. Marketing is as important as good medical skills. Because why? Because it helps you to reach more patients. It helps you to retain the current patients. Approximately 90% of the patients will look for doctor's website, whether it is a website of the doctor. And communication tools that patients are looking for is blogs, social medias, chat rooms, contact forums, tips and advice areas of practice. This is a new skill which you should develop. Then latest software. This has become the vital part of healthcare industry today. There are approximately 1.5 million medical devices available today. Without this, advanced medical devices, is impossible to treat or diagnose a patient. You saw the slides shown, the video shown by Dr. Sanjeev, and you saw the latest gadgets, latest medical devices. And to manage those devices, you require software, which are crucial. So they are designed to give medical devices a range of functionality. Wireless communication is another plus, which helps schedule appointments, diagnose patients, billing the patients, insurance companies, and prescribe medications. Staying up to date. This is a Medalium. Here you have come to stay up to date. You have learned to learn more. What is the latest in the technology? What are the new medical studies? What is the new research? What is the new disease? What is the new medication? What are the new theories? You have to stay yourself updated, because patients who come to you are more updated than you, because of the easy availability of this internet, through which they can scan through entire thing. They will come and sit to you and they will give you their gyan. When you say that you should do this, they will advise you reverse, because of the availability of technology. So you need to stay up to date. Patients are always looking for a doctor with knowledge of the latest breakthroughs in treatment. To be a successful doctor, you should never stop learning. Even at this age of 62, I still keep learning. There is no end to learning in medical science. When Dr. Sanjeev was telling his father is 92 and still is practicing. So that is the full practice. Strong communication skill is a must. Do not blunt, but take time to engage in meaningful communication with your patients. The patients are of average intelligence. They don't know the language. They are not as brainy as you are. They don't have that high IQ. So you should know how to talk to a patient who is of much lesser intelligence. Most patients complain about the lack of communication skill and not lack of competency. Every one of you here will become a competent doctor, but how many will become a good communicator is something which we have to see. So while competence is extremely important, good communication skills and also help improve the outcomes for a patient. Then convenience. To be a successful doctor in today's medical world, you will need to possess these traits. Today, most people are often in a compromised position when they are ill. The more you do not inconvenience your patients, the more grateful they will be. This helps you retain your clients, makes you more popular amongst potential clients that are currently dealing with doctors that do not have these early appointment times, open access to intensive care units, short waiting time, present and professional staff, short NPO times before surgery. Do not become complacent. Always ask yourself, how can I become a better doctor? Apart from this necessary 5 skills, you need certain addendum, what you are studying now. Students are so intelligent that they can grasp all these 19 subjects in a jiffy. They don't need, they are nowadays not finding the necessity of going to the classroom. They can sit in the rooms and read. They can as well bunk the classes. Why? Because those skills they can read in the room. Why do we go and listen to a boring lecture when nobody is interested? Because you're so intellectually, God gifted. So this medical 90 subjects is not the only thing. You need these skills, which you cannot sit in your room and learn. Impossible. You cannot sit in your room and learn. What are those extra additional skills? We need to learn administration. You know how to administer your clinic, your hospital, your nursing, to learn about management, which I talked about earlier, more so about digital marketing. Communication cannot be done in the room. You have to get out, go to the bedside of the patient, talk, communication skill. And then you have to learn self-defense. I think there should be a short course introduced here, wherein you will be taught how to save yourself. If somebody tries to attack you, you should be ready to counterattack. So you need this self-defense technique. Then you need to learn about medical jurisprudence. Otherwise, you will be sued in the court few lakhs. Simple. A drug allergy, a person takes paracetamol, develops anaphylaxis, he's sued for 2 crores, 3 crores in the court. What are you going to do? Your career will be almost over, finished. Paracetamol is a very simple drug, over-the-counter pill. But still patient can have reaction for that. So if you don't know how to handle legal issues, you are in a soup. All this knowledge will not come to your rescue then, right? And then we will need to learn about finance management. First of all, for a doctor, finance is extremely difficult. You will not be earning so easily. You will have to struggle to earn money. And then once you earn money, you should know how to manage your money. Otherwise, accept it. Online consultations, consultation over videos have become a reality. And it is a growing influence. You have to adapt it. Otherwise, you will be left behind. You need these additional skills as to how to diagnose, how to advise on a telephonic conversation. You have to be extremely careful here also, because one slip from your side, patient develops a reaction or complication, there you are likely to be sued. Then you need to indulge in physical bonding. Please raise your hands. Look at that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 10% of the students out of maybe 150 or 200 delegates here, no physical activity, no physical, no yoga, no swimming, nothing. If I do maybe once in a week or once in a month, the huge spirit, the God, and how you should, generate the control of your mind. Yet, all this knowledge, the medical curriculum, the special skills and additional skill, at the most can make you a good doctor from an average doctor. But is that enough for you? Is that enough? If you become a good doctor in a town, is it enough? Why not convert this good into a great doctor? It's a different our position. Or is it a holistic success where you're peace? Everyone, without exception, wants to be rich. Everyone without exception wants to be immortal. And everyone without exception likes to scale the summits of life. and be successful. But only if you become Narayanamutis and Tatas. For medical professionals. We need to recheck and introspect here, all young graduates. What is your goal? You want to make a living, you will definitely make a living. Practice a curriculum to make a living. Or whether you sing to society. For that, you need principled living, and we need to inculcate. Nobody is going to teach you that. You know? So, as your goal, these are the two put here. One is Mother Teresa, or like a saint. Is it possible for you all to become Mother Teresa? You will say, what? We have too much of our life. We don't want to be doing service like Mother Teresa. We want to earn money and have a business model and be successful. Or you aim for both, business service. Excellent. If you can earn money and also do service, and if you can, satiate your inner fulfillment, why not? That could be the best thing what one can think of. So, depends. Now, on what is your goal in life? If I ask young students, what is your goal? They'll say, I want to become a fellowship. Okay, attend. Then next what? Next, I want to go abroad. Next what? Next, I want to join government service, or I want to join corporate hospital, or I want to start my own. Attained. Next what? Now I'm very happy. I want to get married. You get that. Then what? I want to drive BMW and Mercedes. You will get energy flows, things grow. Wherever your attention goes, energy flows. Suppose you want to make a very successful living, that is what you're thinking. So the energy will flow in that direction and things will grow. This is nature's law. So if you plan for a living, you will definitely, definitely. But what if you plan to make a difference? You want to make a difference. How? What is the set of rules? Good doctor versus great doctor. How should be the approach? First, of course, to become a great doctor, you have to be a good doctor. Without being a good doctor, you cannot become a great doctor. So to become a good doctor, all these courses, Medalium, everything will help you. Then the choices in life are in front of you. There are plenty of choices you'll have. There are two paths which you can choose. First path and second path, which I'll elaborate now. In life, choices versus consequences. Path one, control. You have no control over the choice. You will have to live the choice. It is like saying, when you pick up a stick, you pick up the other end of the stick too. You have no choice, right? So first path, conventional versus unconventional. Conventional choice, situation number one. Graduation, post-graduate training, fellowships, private practice, job, government or private, teaching post, going abroad, marriage and family is the first conventional choice, which 95% of the people choose. There is a second choice. After graduation, you do post-graduation. but not all are lucky. They don't get to do fellowships because of finance issues or because of family issues. So they just no training for them, no fellowships. Then they go again from 5 to 9 choice, like private practice, job, teaching, post abroad, without doing fellowship. That means graduation, post-graduation, settlement. The other one is graduation, post-graduation, training, fellowships, and then settlement. Then there is one more choice, unconventional choice. What is that unconventional choice? Do MBBS, get married. How many dare enough to do that here now? Not a single hand is being raised. MBBS, marriage. Then family, to get kids. Then you go for PG, post-graduation. Then you make the career choice. Then you think of training, fellowship. This is the unconventional choice. You have got 3 options in front of you. Okay. Now let us explore one. Path 1, graduation, PG training and practice. So here on point 1 to 10 scale, graduation, post-graduation, training. This is also a training, what you're undergoing now. Then do fellowships later, then set up your practice, then lifelong practice. Till you die, a doctor keeps practicing. You ask any doctor, he'll be sitting in his clinic or he'll be sitting in the nursing home, hospital, practicing. So this is path number 1. This is Medalium's focus here. What is Medalium's focus? Training. They're training you. They're training you all here. So this is path number 1. And how to train? See, you have to start from the basic, like how to put a suture, how to suture an episiotomy, how to do a dressing. That's what you're being taught. That is how these great people like Raj Kapoor and Hrithik Roshan started. Raj Kapoor started as a clapper boy. That was his first. He started from the basic. And Hrithik Roshan was asked to sweep the floor. His father made him, suddenly he did not become a superstar. His father told, you have to come from the grassroots, then first sweep the floor and then will become a director, assistant director, then an actor. That means what you are now undergoing training is the same thing what a great person becomes by training in the basics, like how to do a CPR, how to put a dressing, how to put a drip, how to put a Riles tube, how to give an enema. These are the basic skills you need to learn to become a great doctor. And then identify people with successful private practice. Follow their formula. Here, Dr. Trehan from Medicity. So you just do a case study on him. How did this guy become so rich? You will also produce the same result. You also produce the same result. You learn, modulate on him. Second situation, conventional choice, degrees, no training. Are they doomed? Are they doomed? Look at this extraordinary choice I'll show you now. You have degrees or skills, but you don't have training, no fellowship, nothing. After PG, you are forced to get into service. Now look at this guy. Hippocrates, Sushruta, Charaka. No medical degrees, no post-graduation, no books, no computers, no internets, no library, no training, but still their names are remembered from generations to come. Thomas Alva Edison, no engineering degree, no training, only elementary schooling. Yet he scaled dizzy heights. The very bulb under which you are sitting now, the projector which I'm projecting is all the discovery of Thomas Alva Edison without any engineering degree in his name. Wright brothers, no engineering degree, no experience, no training, no education, but they found out aeroplane. Okay. Here, Mohammad Rafi and Kishore Kumar, one is trained, another is untrained. Mohammad Rafi is trained, whereas Kishore Kumar was untrained. The great music maestro Naushad used to hate Kishore Kumar because he did not have formal musical training. He used to just sing. But you know how famous Kishore is, and you can understand training matters. But if you're untrained, it is not the end of the world for you. Narayana Murthy, Infosys, trained, an IIT graduate. Bill Gates, 9th standard pass. And you know who is Bill Gates? So no training. Sachin Tendulkar, trained under great Ramakant Achrekar. Whereas Virendra Sehwag, nobody to coach. He plays naturally. No, training is not there. But did it make it a difference to him? And here, Steve Jobs, a school dropout. Just elementary colleges, no degrees, no training, no experience, no fellowships, but they all made it big despite these hurdles. Their achievements are not paralleled even by the most qualified and well-educated engineers and scientists in this world. Then what was that made them tick? It was the attitude. They created their own opportunities. They created their own training. They changed the way the world functions. They become immortal. They cut that T from Kant and made it from impossible to possible. And most of them followed Arindam Chaudhary's 9 P's. Arindam Chaudhary's 9 P's for success. Discovering the diamond in you. Each one of so what are tools to discover it? These are the 9 tools. I'll show you them. Passion. The passion. If passion becomes profession, then you are on the way to success. Positive energy. You have got so much positive energy. You infect people with energy. Not, your face is, like that. And the moment patient sees you, he will die, on the bed itself. Looking, the doctor himself looks like patient. No, you are exuding positive energy. Even a dying patient will feel that, okay, I can live. So positive energy. Perseverance. You have to simply wait for your chance to come. You cannot get frustrated in life. Okay. And then performance. Your performance. Narayana Murthy, son of a middle school teacher. And look at his performance as an Infosys giant. Personality. Dr. Pratap Reddy, who established Apollo Chain of Hospital, just an MBBS graduate. He has got 40 hospitals all over the globe. And all the best brains are working with him. He is just an MBBS. So that the personality. People-centric approach. The low-cost airlines found out by Gopinath has revolutionized air travel in India. So people-centric. His goal was to help the people, right? Perspective, visionaries. His vision, Bill Gates' vision, you know what it was? His vision was that there should be a computer in every house. That's all. That was his vision. And he attained it by producing so many computers. And then principles in life. The spiritual guru, Pandit Sri Ravi Shankar, who released one of my books. He is a man of principles. So you need to have that 9th P. And then the 9th, P of Arindam Chaudhary's patriotism. You love your country. You don't ridicule your country. I have seen so many, including my children, when they become good doctors, great doctors, the first thing they do is they start finding fault with our country. What is this nonsense country? So much of corruption, so much of pollution, and they all fly off. And they deride the country which brought them up and gave education. So patriotism is extremely important. If you all, each one of you is sitting here, can practice these principles, it will take you to greatness from goodness, like how these people did. So it is called syntax. Syntax means you do the same thing what a champion does, which I showed now, 9 P's. Then you will definitely reap that, the success. Then this is third, the unconventional path. What if you are being different from the rest? What if you follow the unconventional way? Are you doomed? What is that unconventional way? Graduation, marriage, children, post-graduation. If you follow that path, are you over? Your life is over? Let's see. Let me tell you my story. Our dean said that even if you have one award in this, I'll be happy. This guy has got both. Padma Shri Award and Dr. B.C. Roy National Award. So this is my story. Let me tell you. My professional life started in Karnataka Medical College, Hubli. As a houseman, I got engaged and married a PG who was 3 years elder to me. I was just 24 years when I got married. And my personal life commenced, which is called now Harakiri in today's time. Or what I call, I started my life in a reverse gear, not forward, backward. So that is how my life started. I chose my life partner, Dr. Parimala, who is a gynecologist now. From my music team, we had a Medicastra. I chose my life partner from there. Then I was father at the age of 25 years. Disastrous decision for a youngster now. My son was born when I was just a 6 months PG. Okay. And then I did my post-graduation Jain Medical College, Belgaum. They told me that your career is doomed, man. Even before you could start your post-graduation, you have got a kid, you have got a wife, and you are over. I was posted into a village in Karnataka called Alnavar, which is about 30 kilometers from Dharwad. So my wife was working there. Then I took up government job because I was kicked out of my house because we ended up in a love marriage. And you know what is the fate of love marriages then? They kicked me out saying that you married at 24. So you please leave and take care of yourself. Then what I had to do? I had to take up government job. I took up job as an assistant surgeon, and I was an orthopedic surgeon. They posted me into family planning department and asked me to do tuberculosis. Then they asked me to do a camp. I was given a jeep, a nurse, and a ward boy, and huge bins. I was asked to go around and the taluka. I was in Hassan Taluk, Hassan district, and operate and do. I said, sir, I'm an orthopedic surgeon. No, you may be anything. You may be anything. You have taken a government job. In government job, only MBBS counts, not your post graduation. Please go, otherwise quit the job. I could not quit the job because it's my survival. Okay, then I started taking the jeep, running around in the village, in the schools. All benches were put like this, and patients. And my sister she used to go local anesthesia. I used to come, make a neck, pull out the tube, okay, like it, close, and then go to the next table, go to the next table, go to the next table. Like that in a school, I used to do the tubectomy camp. I was forced to do it. I did it. I won a state award for it. You can see it. My name is displayed here in Kutumba magazine in Kannada, in Department of Public Health, in Karnataka. I won an award for that also. What? Doing tubectomies. Most number of tubectomies. My DHO came and felicitated me with a towel, shawl, plate, and all, because I reached 100% target as an orthopedic surgeon doing tubectomies. That is how my life started. Then did my diplomate of National Board in Bangalore Medical College, and I found that to teach young students like you is the best way to coach yourself, not going to coaching classes and taking up NEET exams. No, you coach youngsters, you'll become much more perfect than all. So I had the option, like you all, to do a UG, PG training, then go to the dead end. I said that's a dead end. Once you start earning money, then you are nowhere else to go. You are reached your dead end, and then that will be your end also. So I had this option, but I chose the other option. I went into this unconventional path: academics, teaching, books, presentation, research, newer treatment methodologies, professional bodies heading it, social service, academic, public education, community education. Then comes practice. You see where the practice is. After 10th option of mine is practice, extracurricular, and then activities, then fulfillment. So my first priority was teaching. I was a very popular teacher for MBBS and PG students in Bangalore Medical College. They used to flock to me. Even in the nights, they used to come to me for my clinics. And I was very, very happy teaching, but I was a selfish guy. By teaching them, I was teaching myself. To pass the exams, diplomate of National Board, I passed in first attempt. Out of 48 students who took exams for DNB, only 7 passed. In that, I was the one. And the success for my passing was not because of my brilliance. It was because of these young students who allowed me to teach them. By teaching them, I learned twice. I became expert, and I could, diagnose the case quickly like this. So first teaching, then books. I was the only orthopedic surgeon in the world today to have written over 200 books for a wide genre of readers, whether it is MBBS students, postgraduate students, practicing orthopedic surgeons, physiotherapists, nurses, lawyers, general public. I got over 200 books. I have got 2 Guinness World Records in book writing. So that was my book writing, skills. Then came presentation. All around the globe I have gone, Egypt, America, UK, you name the country, I've gone. Over 300 presentations I've done, so far, and that gives fulfillment. Then I went into research. Yes, Vyasa, what our Vice Chancellor was telling. You all will become technocrats. You are super brains, but you'll become a technocrat unless you resort to research. So this was, you are fortunate that a Vice Chancellor is telling you that. I was not fortunate. Nobody told me to do research. I had to do myself on my own. And I joined Vyasa Yoga University in Bangalore. And so far, I have got 70 international publications in peer-reviewed and indexed journals with my research. Then I became the only orthopedic surgeon in India whose name figures in the non-arthroplasty treatment guidelines by the American Academy of Orthopedic Surgeons, which is a great honor for me. These were 3 research papers of mine, which was picked up by AOS to frame the guidelines of non-operative treatment for knee replacement, the knee surgeries. Then went into community service. I have my own trust called Swasthya Health Foundation. With that and with Rotary and with orthopedic bodies, I have done over 500 free surgical health camps. Then I went to Nepal, risking my life, and served these people in 2015. These were the mangled remains of Nepal. My family was scared whether I will come alive. You know, the hotel where I was staying in Kathmandu was shaking every night like this, gad, 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 gad. Then we used to, think how to, run away once if it starts falling on our head. Though by rotation, we all were awake. We were some 5 doctors who had gone from Karnataka. By rotation, 3 hours I will sleep, 3 hours you sleep. If it starts shaking, you wake us up, we'll run. So that was our plan. No, because we were destined. We thought we were mentally prepared. If I die, okay, fine. Let me serve and die. Rather than die somewhere like in a heart attack or a road traffic accident or suicide. Better to die serving people. That was the mindset I had when I went there. Then I became a COVID nodal officer, government of Karnataka, for 274 days. In the first phase, when there was no vaccine, I worked for 274 days on field. With only a mask as my weapon. War against COVID-19 when there was nothing. It had just broken out and we were under great risk. I did 107 days duty on railway station platform, standing, screening the patients, guiding the youngsters like you how to screen. And then I became nodal officer of Bangalore, municipality board, West Zone for 167 days. Relentlessly I worked. Going around, and these were the places I worked: railway station, bus stand, slum, footpath, factories, shopping malls, housing complex, public place, red alert zone. Then railway, I screened, we had 1,700 and 103,000 passengers. I held them screen. And then I visited 87 PHCs as a BBMP nodal officer. 339 teams were under me, 132 wards, 1,215 staffs working for me. 66 lakh population of Bangalore was covered by our team. So this was the railway station duties I did, standing there as an orthopedic surgeon doing community work. And that is where I am privileged. This is the only profession which gives you both intellect and mind and service. If you combine that, you will go into the greatness. Then I became the medical superintendent of a general hospital, which is a 250-bedded general hospital called C.V. Raman Hospital in Bangalore, which was on the verge of closure with only 29% occupancy when I was made the medical superintendent of this hospital. When I left that after 18 months, that hospital occupancy rate had gone to 89%, and I got a national award for that hospital for excellence. Then I revived a 250-bedded, 119 years old, sick CSI hospital in Bangalore. This was the first corporate hospital which was formed 119 years back. The chief minister underwent his open heart surgery in this institute, which is on the verge of closure now. So I became a medical board member, revived. When I took over, it was only earning 4 lakh rupees per month. Now it is earning nearly 2 crores per month. Then another hospital which I revived was a rural hospital called CSI Hospital Chikbalapur, which was started 108 years back, which was again on the verge of closure. Then I just, helped, rehabilitate this hospital. So what is that community activity you do later on in your life will determine whether you go from good to greatness. No? So these are the community service I did, whether it's Nepal earthquake, whether it's COVID, or whether it is hospitals, sick hospitals getting in. It's not only about mine. It is not about me earning. It is about others are also doing well. That's what we need to do. Then I became former vice president of the Indian Orthopedic Council, which is the premier body of orthopedic surgeons. Then I became president of the Neurospinal Surgeon Association of India. Then I had some unique distinction. I started holistic orthopedics, and I started geriatric orthopedics too. So now founded Geriatric Orthopedic Society of India, which is now doing extensive work in geriatric practice. And then this is the new subspecialty which I've discovered. We have pediatric orthopedics, but we didn't have geriatric orthopedics. Now we have geriatric orthopedics. Currently, when I'm speaking now, one of my colleagues is attending a camp in Goa, where the Goa Medical College has organized a geriatric. Today is Senior Citizens Day. 21st August is a Senior Citizens Day. So we are doing a camp there from Geriatric Orthopedic Society of India, which is my baby. I'm not there. I'm here in front of you, but the work is going on. Then I set a new trend called holistic orthopedics. Simple, East meeting West, incorporating Indian principles into Western medicine was simple thing what I did. That is called holistic orthopedics. It is not holistic orthopedics. It is WHO. That means whole body concept orthopedics. That's what it means, right? And then it has captured the imagination of the world. I've been invited as speaker all across the globe now. I have delivered 40 orations so far internationally. Then I still do my yoga. I still play cricket. I was the captain of my team always. And at this age of 60, 62, I am playing with the Rotary members who are so young. I remained not out. I went as an opening batsman. I remained not out. And I took 2 wickets for 4 runs. in just the permissible 4 overs given to me. I hardly gave any runs. I took 2 wickets also, and I went as opening batsman and remained not out when all my colleagues got out at this age, right? And then 9th priority of mine was music. Inspiration. I have a music band in Bangalore called Inspiration, and I go around. This is a spine conference which was done in Bangalore, and it was completely the entertainment was me. This is me and my wife Parimala. Both of us, have this. We have a team, of course, and we go around giving musical program. My son Rakesh, my daughter Priyanka, my daughter-in-law Varsha, all are accomplished singers. So we all sing all Hindi songs, Kannada songs, you name them, we'll sing, and we enjoy that. My 10th and last priority was practice. Don't think that Dr. John has no money. I have 3 hospitals. Parimala Healthcare Service, Dr. John's Orthopedic Clinic, and Ebenezer Orthopedic Center, both state of the art, and I am earning enough money. Then I became an orthopedic surgeon with 8 Guinness World Records. Not 1, 2. 2 in academics for book writing. Social service. I was not proud of academics. I was proud that I set up Guinness World Record in social service and health awareness, low backache, osteoarthritis, neck pain. I created awareness for villagers. A huge multitude of magnet of patients sitting, all uneducated, treating them how to take care of their knees, how to take care of their backs. And it went on to create world records for me. Then till today, I'm the only TED speaker from orthopedics in India. Only TED speaker to deliver an international TED talk on February 18, 2017. So time for reflection for you all. I've just told you my story because I can tell anybody's story. I can tell Edison's story. I can tell Narayana Murthy's story. Then you may feel that, oh, doctor is telling story of somebody else. I've told you my own story. I am standing in front of you as an example now. So you cannot discount me now. You can say, no, he was all talking bookish. No bookish. I am talking my own experience in front of you. So was it the right way I took? What was the right path? Let 300 international national awards I've got so far. Okay. I got the Padma Award. And the significance of Padma Award? 140 crore population in India. 20 awards per year. You get award 0.609. That means 120 awards only in a year for 140 crore population. We are nearly 50,000 orthopedic surgeons in the country and 3,000 in Karnataka. Only 18 of the orthopedic surgeons have got Padma Shri award so far. So total Padma Shri given from 1954 to 2022 is around 3,000. That's all. For 30, how many years now? You can imagine from 1954 to 2022 is almost, I think, 70 years now. Only 3,000 awards. That means on an average, only 50 per year in India, out of 140 crores get the award, and only one orthopedic surgeon in every 3 years get the award. So these are the illustrations of the other Padma Shri awardees. In that you can see Dr. Sancheti's name here, and you can see Dr. P.K. Sethi and Yash Gulati, Raj Gopal and all. So I was one among them. And with whom I shared the award in 2016. If I say that I got a Padma Award, you may not be very happy. Then you see with whom I have shared. Pandit Sri Ravi Shankar, Dhirubhai Ambani, Rajnikant, Sania Mirza, Saina Nehwal, Priyanka Chopra, Ajay Devgan, Rajamouli, who made Bahubali, and Udit Nayak. So was it not a proud moment for we medicos that one of the doctor was then got the Dr. B.C. Roy award, which a doctor can get from the medical council here. How significant it is? Only 11 Indian orthopedics have got since 1962. This is the list of 11 people. And to get both Padma Shri in orthopedics, Dr. B.C. Roy National Award in the single calendar year, there is no record in India. Getting both the top awards in a single calendar year. I become the first doctor to get both, right? So, and I got a MCI award for research, a Silver Jubilee National Award for research. Then the B.C. Roy National Award was for community service. So these are the 3 wings of a doctor: practice, community service, research. I got award for all 3. National Award for Research, Silver Jubilee Research Award by MCI, and then the Dr. B.C. Roy Award for Socio-Medical Work, and then Padma Shri for my orthopedics. So from nothing to Rashtrapati Bhavan twice, that is my journey. If I can do it, why can't you do it? If I can do it, I don't have 2 brains, I don't have 4 eyes, or 4 limbs. Just like you, I am. If an ordinary man like me can do, each one of you can become a Padma awardee. Each one, right? I had no family background. I had no godfathers, no great institution backing me, no government support whatsoever. But still, I shared the space with Prime Minister, President, Vice President. I'm standing just behind the Prime Minister. You can see there. Just behind Prime Minister, I'm standing. It was such a, and the person next to me is the ISKCON, founder and ISKCON president of India. I think his name is Puja, the ISKCON. So those kinds, and Priyanka Chopra is there. 1, 2, 3, 4 on the left of me. So I shared space with these all. And I was feeling proud as a doctor to be there because I was not a celebrity at all. I'm a just ordinary man like you and me. So I had made an unconventional choice. I faced ridicule, criticism, rejection. So how did I reach that level? My foundation has taken me there. I grew up listening to the stories of Mother Teresa and Dr. Ida Scudder from my mother. It was my mother who told me, you are not going to become a doctor to earn money. She told me when I was joining at 17 years about school, she told me, if intention is to make money, please don't join medicine. You can become an IAS officer, or you can go into engineering, or you can go into some real estate kind of thing and earn money. But if you are going to become a doctor, then these are the 2 role models you should follow. She told me when I was very young, she told me, see Mother Teresa and Ida Scudder, they should be your role models. Then I promised my mother, yes, I will follow them and I will fulfill your dreams. So from conventional to unconventional, you find your passion, stick to it. What are the mantras for success? You have both conventional and unconventional. Either of the choices can lead to success for you. There are lesser fortunate people who made it very big in life. Those without training opportunity need not despair. If you make an unconventional, no need to worry. You can still reach the top. I am a prime example for you. So in this model, you can see your success as a doctor is based on what is your core value. It is not just training. Core training, become MBBS, PG training, extra skills practice. That is what you are. Then there is on the other side, left side, you can see core values. Money, power, family, ego, principles. What is your core value? Everyone has to go back to the rooms and introspect. What is my core value? Okay. So that is the second path which you need to take. For lasting success, you need to change your core belief system from materialistic to principle based. Your core value has to change. So what is those principles? Ethics and principles. Ethics is honesty, integrity, sincerity. Principles are these, which I'll enumerate now. Be ethical towards your patients. Be honest to your patients. Look upon your patients as your extended family. You don't do this to your parents. You unnecessarily don't replace the joints of your parents. You don't do it for your grandparents. Then don't do it for patients also, if it is not indicated. Have the principles, following principles in your life. Don't start your life without a role model. Model on them. Choose anybody of your choice, maybe your father, maybe your brother, maybe a surgeon, whomever, but you choose the right role model and model on them. Let service be your motto and not money. You aim to become a good doctor and not a rich doctor. That should not be your aim, that I'll become a rich doctor. No, you aim to become a good doctor. And service, keep service as the motto. Medicine is the only profession where you get to do service every day. Your road to immortality. Embrace service. Then our profession is service-based. Keep it that way only. My mother told me these stories, selfless people, great people, and told me to emulate them. Mother Teresa. So she told me to emulate them. You also think of emulating her. That is our service. Third principle, contribute to society. What we should aim is to become a good doctor. And who is a good doctor? A good doctor is one who will contribute to the society. This is Dr. Ida Scudder, who started Christian Medical College with a single bed dispensary. Now you know where CMC Vellore stands. It was started by one non-medico initially. She was a non-medico. She came to India. She was from US. She came to India where her father was a gynecologist practicing in Tamil Nadu villages. So she came to him to stay with her father during the vacation. And one midnight, there was a knock on the door. There was a village, man standing, asking, there is my wife is delivering. Please, there is a doctor here. Please come. So her father picked up the bag and started leave. Then asked that the villager asked, who are you, sir? No, I'm the doctor. No. We don't want male doctors. I don't want any male doctor to deliver my wife. I want a female doctor. Then he said, unfortunately, I'm the only doctor here. Then he said, no, sorry, I don't want. He just left him and went away. And this was watched by Ida Scudder. She was watching in amusement that because her father was a male, this patient was not ready to take him along. Then she went next day to find out what happened. And to her horror, she found that both mother and child were dead because no doctor attended on her. It shook her conscience. It said, people in this country are ready to die, but not willing to take the service of a male doctor. Then she immediately said, this is my life's calling. She decided, I'm going to become a doctor. I'll come back and serve the very people which my father did. And she goes back to US. From commerce, she changes to medicine, comes back after 5 years as a doctor to the same village, starts a single bed dispensary for females, for women, and then goes on to build this hospital. Still today, Christian Medical College is for females. I don't know how many of you know. Majority seats are for females only because it was started by Ida Scudder with her vision. You can imagine what contribution she has done to a society, being a very ordinary person. She was not a highly intellectual IQ with a 90, 100. No, she was just with a golden heart. So this story was told to me by my mother. And be a visionary, contribute to the society, Think about society, not your family. Don't think only about your son, your daughter. No, think about the society. Be a visionary and leave a legacy behind. When you pass away from this world, the world should remember you. They should say such and such doctor passed away. So many people die. Nobody remembers how many people have died. So leave a legacy. If you leave a legacy, they will remember you. See, these are the guys who will never die. Isaac Newton, Einstein, Edison, they will never die. Leave a legacy behind. Aim that I should leave my legacy behind, not wealth behind. How many cars you have, how many money you have, how many crores you have in the bank. Nothing is going to count. Rakesh Jhunjhunwala had $5 lakh billion in his account. Not a single dollar he could carry. He left everything and went. Why? Because you don't carry money. So don't aim at a legacy like that. If you aim at a legacy like that, this is where you'll end up. Either in the prison or somewhere, like that, because money was your goal, and you will change all your principles to earn money. And what happened to Telgi, what happened to Dawood Abram. They're all languishing in the jail and one is already dead. So the principles, you should know how to conquer your desire. Your desire is the one which is your Waterloo. It will sink you, your desires. How you should conquer your desire to become ethical. This is, I'll tell you the Life of Pi story. You might have seen this movie, Life of Pi. He's trapped in a boat with a Bengal tiger. So he is the hero, take him as the hero. And the tiger is your desire. That's your desire. And the ocean is the life, where is a single boat. He is left with a tiger and the tiger is about to eat him. Right? So that is how that is our life, how our life is. I am the hero of my life, and there are plenty of desires I have, and the whole world is my stage. Right? So what he does after several days of living with a tiger, he understands that he cannot tame the tiger. It is impossible for him to tame the tiger because it's a ferocious in circus. Like that, he realized he uses a stick to train the tiger. Right? So likewise, you train yourself to control your desires. Your desires within you are like this tiger which is about to jump. So you learn how to tame the desires. Okay, your desires will leave you once you die. This tiger, as soon as they reach the shore, it passes away into the jungle, even without looking back at that fellow who was with him for so many days. So it will be like that. Your desires, if you court your desires, one day to leave you and go alone, you will be just time like that. So live with your desires, but don't allow it to overpower you. I have a Maruti car. No, now I want a Toyota. I have Toyota. Now I want Mercedes. I have Mercedes. No, I want now, Tesla. I have a house. Not enough. Like that. Desires. Try to control the desires. Enjoy your life. Life you enjoy, not the desires. It is an adventure. Your life is an adventure. Try to enjoy it. So these ethics and principles with firmly in place, now you are ready to embark into the world as a doctor. So you cannot choose these things. Our life we cannot choose. Our religion we cannot choose. Our parents we cannot choose. Our country we cannot choose. These are all predestined. But we can choose the way we want to live. That is in my choice. Inculcate these 44 belief systems in you. What is the belief system? Focus on the foundation of your life. That is one belief system one. Belief system two. First, have a blueprint of your life ready. You don't build a house without a blueprint. But you are ready to start your life without a blueprint. Which is more important? The building is more important, or your life that is more important? If I ask you what is the blueprint of your life, I don't know how many of you are going to answer now. So you prepare, sit, introspect, find out what is the blueprint of my life. What is that I want to see at the time of death? I have attained that blueprint, right? Then begin your life keeping the end in mind. Always keep your end in mind. This is your end. So I'll start there. Remember, you're just a guest in this world with a limited time. Your stay here is only for a brief period. Okay? You need to make your life meaningful and accountable. And you need to leave the imprints of sands and time. And you belong to the universe. You're a part of this big world, right? Your life is not just for your family, state, and country. Make your life useful to others, not only for you and your family. Be like nature. Contribute. You always contribute. See, animals don't hoard wealth like us. Okay, these, nature are not selfish like us. They only contribute. And don't be in the rat race. Why? Because even if you win in the rat race, you are still a rat only. Yeah, you are become a Pied Piper, wherein all the rats will follow you. We all are into rat race. That fellow is doing 1,000 knee replacement. I will do 1,500. Rat race. But don't indulge in that. Buddha renounced his material desires. He said, no more wealth for me. I don't want the palace, the money. He renounced it. Why? Why did he renounce this? He wanted to find fulfillment and greed of wealth. You remember these Chadda brothers? They shot themselves. They're so rich. They shot themselves. Greed for money. And then don't spend your time hoarding wealth. Okay. This is the Gaddafi who was shot dead in a drain. He was having 3.26 lakh crores as wealth. He was shot dead in a drain. So don't waste your time trying to accumulate wealth beyond means. Former President Obama, always every year, he used to lie down in a coffin box and they asked the people to close the coffin box. So he wanted to realize death. Then he used to experience death and used to think how useless my wealth is. It cannot protect me. So that is how he used to bring himself down to earth. That about wealth. Then materialist things don't bring you peace. Don't expect or wish anybody else's money. And the greed of power. These Napoleons, Hitlers, what happened to them? So no greed of power. See, Ashoka gave up power. He said, I don't want any power because he found the futility of this. And, Jesus Christ, he gave up heaven and came and lived with us. He did that. And these, the leaders, world leaders who promoted their family to become extinct. And here is our own Lal Bahadur Shastri, who did not promote his family. His children went in a Tonga to school. And the children complained, Prime Minister of India's children are going to Tonga in school. Ordinary business people are coming in, Benz car and all. Father, please get us a car. He said, I don't have money to buy a car for you. If you want to go in the Tonga or you go walking. That's what the Prime Minister values, the high values. And never be ashamed of your roots. No one is superior. And be stable in all situations. This is the photograph I took of a Nepal earthquake victim. His whole family wiped off, his property wiped off, but still he was stable. I did not see a single Nepali crying in my earthquake duties. They were all accepting what has happened, right? And then Nothing is permanently planned. You know what happened to Amitabh Bachchan? He was bankrupt. His building was about to be auctioned by Canara Bank. Then how he changed his course with KBC. You all know that. So good times or bad times will not stay ever. So don't give up hope. And then when your profession becomes your passion, then work is worship for you. Remember, a champion does not do different things, but does things differently. Love and serve your country and people. Do not despise them. They need you. Give back to the society. The whole world is your stage. Never indulge in extravaganza. Don't waste food and all, because so many people, underprivileged people, don't have food. Never take shortcuts. Crime will not pay. Don't take that. Love yourself. You are unique. Believe in yourself. Never accept failure. There is nothing called failure. It is only an experience. I have not failed. I have just found 10,000 ways that don't work. That was told by Thomas Edison. So you are not a failure. Failure is your friend. You are a failure, not because of failing, but by refusing to getting up and trying again. So failures are part and parcel of life. If you don't fail, you don't learn. If you don't learn, you will never change. Be forgiving. Forgive people. If they insult you, humiliate you, forgive them, because otherwise you will be, let go all these negativities in life. And self-help is the best help, so do it yourself. And you are the architect of your life. Do not waste time in unnecessary prayers and rituals. That homa, this homa, that puja, this puja, all that is not going to help you. Take it from me. It is not going to help you. So don't waste your time in all that. Just do your job. Do not remind God his job. Unnecessary rituals. You are trying to remind God, please help me, please. God knows that he has to help you. So don't remind him his job. You do your job, which is very important. This famous movie, I don't know whether you have seen this, Manji. In that he says, Bhagwan ke bharose mat baitiye, kya pata Bhagwan hamare bharose baitha hai. Bhagwan hamare bharose mein baitha hai ki I will do something and bring good name to God. So don't wait for God to act. Work hard. No one has died working hard. And even if you don't work hard, look at the jewelries. The gold, if it fears fire, it will not become jewelry. The wood, if it fears cutting, it will not become a beautiful furniture. That's, you don't resist hard work. Then be a part of the solution always, not part of the problem. Learn that system and don't expect justice and fairness in this world. You'll always feel why I am being targeted, why I am being humiliated, because you will not get justice and fairness. So many people people died in COVID. What wrong did they do? That's all. Don't expect. Just accept. That's all. Okay, this is my fate. So no justice and fairness. Dedication always. And beware of the social media, the mobile, the internet, the Facebook. They are good servants but bad masters. Don't allow them to become bad master. Embrace discipline. Pace you handsomely. Always help others and never lead a life of regret, and indulge yourself in charity. At least 10% of what you are, give away to people. Don't blame circumstances. Make the circumstances work for you. Don't say I am in Solapur. If I was in Ames, Delhi, I would have changed the world. No, you can change the world wherever you are. And embrace and express gratitude in life. Remember your country, parents, teachers, the teachers who have spent their life here teaching you. Don't forget. Don't say, I have seen students passing and coming out and telling, oh, हमारा teacher बेवकूफ है. क्या आता है उसको? Old man, old lady, सब outdated. Exam pass होना था इसलिए उनको respect देते थे. Now I am smarter than them. I have heard my PGs talking like this in front of me. They disrespect the teachers. They say teachers are outdated. Never do that in your life. Teacher is the architect of your life. If you humiliate him, you take it from me. No 36 crore God also cannot save you. They cannot save you. If you humiliate teachers and parents, no one will come to your rescue. You may be the most intelligent guy in the world, but values are important, and nothing is a handicap in life. Only your attitude is a handicap. And respect and love your parents. Don't send them to old age home. Don't send them to old age home, please. Take care of them. This I am saying as the president of the Geriatric Orthopedic Society of India, where I have been pained to see all senior citizens, most of them lying, languishing, waiting for death to come in old age home. Never do that to them, please, in your life. Okay? And don't go this way. Don't commit suicide in your life. Like that, I had got so many suicide. Always give life a chance. Don't never think suicide as an option, because your whole world depends on your life. Your parents are depending on you. Think about them. Think about your siblings. Don't give up your life for challenges. Practice this, which I've told you. You are ready for any challenge in this world. Don't give up life. Okay. Don't get into this, stress in life. Follow holistic methods, which I told you now. That will take you to success. You'll not be a victim of stress like many doctors. Suicide among doctors is a product of stress. 30% doctors are affected. According to the Indian Journal of Psychiatry, 30% of Indian doctors and physicians go through depression, while 17% have thought of ending their life. A study has shown that doctors have higher suicide risk, 2.5 times more than general population, and about 4 doctors per 10,000 commit suicide every day. Out of 30 suicides, majority of the suicides were from medical education institutions. Never, 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 never think of suicide in your life. That is not the solution problem. This is my young orthopedic surgeon in UK, Javalkar. He committed suicide at the age of 38, leaving this young kid. Don't go this way. Don't go this way. You're not here to give up your life. You're not here to take up the life head on. So the message for you is to become a successful doctor, do this. Just doing MBBS PG is not going to be enough. Pragmatism versus principle. Choose intelligence versus principles both, and then think out of box, think different. Do not compete with others. Try to be yourself. Do not copy. Try to be yourself. And the cardinal rules for well packaged is, then do not be greedy. Do not be unethical. Do not be proud and arrogant. Practice humility. Do not forget your country. Do not forget your teachers. Do not forget your parents. Do not forget the life principles. Rest, God will take care. Rest, God will take care. You will excel in your chosen field. Best example, Sachin Tendulkar. He was the first packaged example for formula for success. Principles, pragmatism, both. They were intelligent and principled. These 4 people, and you can see the result. And develop the self-belief attitude. Conquering Mount Everest. Arunima Sinha, double amputee. She climbed Mount Everest twice with prosthetic legs. Okay, and in everything in life is about attitude and approach. Christopher Reeve, he was the Superman. He became quadriplegic due to a fall from the horse, and he became quadriplegic, and he was a wheel-bound man, but he became a real Superman after the accident and did so much of work for quadriplegics. And you knew about Sudha Chandran. She lost her legs in an accident, and she wore a prosthetic leg and converted that hassle into a success. So here is a man who lost 17 elections, became the greatest American president. They all have discovered the diamonds in them. Now it is your turn to discover yourself. They all practice the 7P attitude of Arindam Chaudhary. You can now practice. So wherever your attention goes, I told energy force. If it is name, fame, you'll get that. You'll get richness, success, titles, car, house, everything. But ultimately you will die unhappy. For happiness depends on success at all, friend. Holistic success. That means aim to being a good doctor, then good son, good daughter, good student, good husband, good wife, good father, good mother, good brother, good sister, good friend, good neighbor, good Samaritan, good citizen, and finally a good doctor. Be a good servant before you become a good, great, master. So do not take, and you enjoy your profession also. Don't take your life very seriously. Enjoy your life. It is not that since you are going to become a doctor, you keep 200 kgs head on your head and always keep your mouth. No, enjoy. Go, dance, sing, do merry, but always keep your focus there. There are the 2 C's: community-based service, commerce, commercial-based. Choose the community service. Go, choose and help these unfortunate people there. Don't go commercial way. And if you treat your patients as a business opportunity, things may go wrong. Are we, you, me, victims of this image called God? People think we are God and think that we should always deliver. No, we have to go beyond this image. Our youngsters are at crossroads. 3 things you are going to face as you go out of the MBBS. 1 is violence, 2nd is litigation, and 3rd is suicide. So I have told you all this. So these are the worst part of being a doctor. The best part of being a doctor, So the worst part are these: the violence. The reasons are multifactorial. It could be because 75% of the doctors face violence during their practice in India. Remember this as you go out. Why? Because of the fear, anxiety, panic, misinformation that people have, mistrust the people have. So misplaced quotes in the social media. This is what makes them attack you. And feeling of wrongdoing by the doctors. Patient feel that doctor is advising for money. He's avoiding his duty, long waiting hours, feeling that doctor is not giving enough attention to me. So no good grievance redressal system. So all these are the types of violence. And what are the types of violence you will face? Verbal abuse, 70% is verbal abuse or violent gestures. The patients curse you. They try to hit you. That is the maximum abuse. That is violent abuse or violent gestures. Then is vandalism, physical threat, assault, and rarely murder. And where it happens in ICUs, emergencies, and visiting hours. So these are the areas where you need to be careful. And who is responsible for the violence? Rarely patients are responsible. It is the relatives, the attenders, the sympathetic bystanders, the political workers, the local goons, and sometimes the police. So they are the people. So what is the prescription for preventing violence? Our curriculum of study has to change. You need to develop more communication skills, understanding the patients who could be violent. You preempt that this fellow could become violent. So be cautious at violent venues like ICUs, the casualty, be cautious there. That is the time when things may go wrong. And you should be ready to run away from that place also if something goes wrong. Or you should be ready to fight back, fight or flight mechanism. And try to educate the patient relatives, improve the healthcare. Some of these are implementable, some are not. So to arrest the violence, what is the role of a doctor? Patient is in heightened anxiety about the disease and finance. Important reasons for initiation of violence. Doctor should train himself to do anxiety alleviation, right? Then avoid the long queues, lack of communication, opaque billing system, unnecessary billing on the patient is the reason for violence. And then when the violence is going to happen, when there is a death of a near and family member, bereavement, be careful. When a patient's or when a member of the family has died, for you, it may be just a patient. For that family, it is the universe for them. He may be the earning member. He may be the only child, right? So have empathy. Don't be gross. Say, your patient is dead. Please take and go. Don't be rude. That is when you will face problems. So when there are young children, when there is only earning member of the family, only child with serious disease, be careful. That is the place where you may be subjected to violence. Studies have shown that seniority versus junior matters. That means if a senior doctor can step up and declare that the patient is dead, then the likelihood of violence is reduced than a junior telling. If a junior says, a houseman says, or a postgraduate says that the patient has died, then it will infuriate the patient. But if a senior stands up and says, look here, I have done my best. So this was the thing. And the people will accept the advice or the news from a senior doctor because they respect a senior doctor. So I feel that my senior doctors who are sitting here, they should help junior doctors when a situation like this arises, where what happens in nursing homes, when there is a death, the operating surgeon will run away. He will call the resident and say, hey, go and tell them that the patient has died. The fellow goes, that resident has no feeling, nothing, goes, sir, your patient expired, please take the body. Then that is where you will get thrashed because the senior surgeon has run away. The junior doctor doesn't know how to reveal. We used to say, don't say your patient has died. You say your patient has passed away. So that makes a less impact. Okay, you understood? Then hospitals should improve. They should have good grievance redressal system, good security system. And the family and society also has to understand that they should not assault the doctors because there are laws now. It is a criminal offense. There will be 3 years of jail, 7 years of jail, and there will be 50,000 rupees that the patient should know. Put up a display in your hospital. And media should also understand they should not highlight the death or violence. They should downplay it, but highlight the success of a doctor. And the government should come out, legal actions should be taken quick, and there should be good training for doctors so that there is no violence. Then the second problem which you are going to face are legal issues. Why do most doctors get sued? Because failure to diagnose. If you don't diagnose, 31% of the times you get sued. Patient suffered an abnormal injury, you have not found out. Then you fail to treat the patient in time. And most importantly, poor documentation is the one which is very, very serious. You should know how to document everything on paper. If you don't document on paper, even the court will not be able to save you. You might have given an injection. Say you have given an intracardiac injection for the heart attack, but you forgot to write it on the case paper. Then when it goes to the court, they'll just see the case paper, that's all. You said, no, sir, real, I have given God promise, mother promise, that promise, this promise. I have given, sir, but I forgot to write. No, you will not be allowed. So documentation is extremely important. So these are the simple measures recommended by experts to avoid assaults and legal hassles on doctors are the best. I offer a different, very simple and pragmatic solution to this growing menace of violence and suing. These are very difficult, no? What I told, how to avoid violence, how to avoid getting sued. You need to have legal knowledge. You need to learn karate. You need to learn so many things. But is there a simple way how to avoid getting sued? How to avoid getting beaten? Yes, there is a very simple way, which you all can do. What is that simple way? Munna Bhai MBBS you have seen? You have seen Munna Bhai MBBS? What he used to do? What he used to do? Jadoo ka jappi. If the patient is shouting, wait, don't shout, come, first give me a jappi, man. Even that highly agitated fellow will calm down. Huh? He said, you may be, having lots of intellect, but use your heart. चल पहले गले लग जा, बाद में मुझे तू मार, नो प्रॉब्लम. तू मारना चाहता है, मुझे गाली देना चाहता है, तू गाली दे. कितना हो तो जी भर की गाली दे, पहले तो गले तो मिल. Simple thing which anybody can do. This lesson, it may be a joke, but it is not a joke. It is true. Suppose if you are highly agitated, somebody keeps a hand on you, will you not feel comforted? You are highly agitated because of some issue in the college. You are boiling with anger or grief. Then your friend comes and just hugs you or just puts your hand around. Will you not feel soothed? Or you will get infuriated. अरे क्यों रे जादू जप्पी दिया मुझे? मैं इधर इतना बॉइल हो रहा हूँ इधर. जादू का जप्पी दिया, मार दूंगा. Will you tell like that? Will he? Will you tell like that? Will you tell? If your mother comes and hugs you, all your emotions will be cooled down. Tuck, immediate. हाँ माँ. Then tears will roll down the ear. तेरा बेटा मर गया, तेरा बाप मर गया. चल, ऐसा लगता है कि मेरा बाप ही मर गया है. You give a jappi. Very simple. Please learn the hugging specialists in the world. Amma from Kerala. Her only thing is hugging. That's all. She only keeps hugging people. Mother Teresa. Only thing hugging. That's all. No legal jurisprudence. No violent karate techniques. Nothing. See the compassion they show. Are we not meant to be this? We are dealing with human beings. We are not software engineers dealing with computers. We are not IAS officer dealing with files. We are dealing with people, human emotions. So you become them. You hug them. You put your hand around. Be empathetic. You don't reverse shout. Just wait. Let the whole steam go. Be compassionate. This is the best solution what I can give. I have not seen any doctor being sued who either hugs or speaks sweetly. Your family doctor concept was there earlier. Family doctor concept. Basic MBBS, that's all. Entire family used to go to him. He is not a surgeon, he's not an orthopedic guy, he's not a pediatric guy. He's just MBBS. He used to sit like this in the house of the patients, drink some cup of tea with them, eat biscuits, and talk to them as family member. And whatever medicine he used to give, that is to cure them. Now you see, one medicine you give the, क्या सर इससे अच्छा medicine दो ना. Google किया मैंने, इसमें क्या है, इससे अच्छा दो ना. Then if something goes wrong, they'll come and hack you. Then even if he gives a sugar-coated pill, they take, मैं अभी ठीक हो गया. क्यों? That belief, that love on the doctor. If that family practice principle can you adopt as a specialist, then you can see the results. You will never be sued. No one is going to hit you. Okay? Be kind and affectionate to patients. Will anyone assault or sue a doctor who talks, listens, touches, and hugs? I think no one will do that. So let us bring back that nobility into our profession through love and service. How I wish Harsh had inculcated in this Medalium life skills. How he had taught you all how to hug the patients. How he had prepared a workshop wherein how you talk to a patient who has lost his family member. A skill, workshop skill. How you should avoid, how you should fight back, how you should use simple things in your defense when you're attacked. I think next Medalium, fourth Medalium, should have this life skills. Where is Harsh? अरे हर्ष, हाँ हर्ष बैठा है. देख हर्ष, मैं तेरे को ज्ञान दे रहा हूँ. Next, one day workshop, you keep this yoga, meditation, life, how to communicate to the patients, bad news, how you are going to declare the bad news now. Train these guys. They will remember you for lifetime. One day the situation may arise for them. Then the training will help them. Not only suturing out, that's all good, fine. I'm not saying that's wrong. Please sit. No, you please learn life skills as a workshop for young doctors. So this is my advice to all youngsters. Have a bigger goal in life. Why? Now I end my talk with this small thing called Vaivavos. How many Vaivavos you people face in your life? Tell me. From first MB to final MB, 19 subject Vaivavos, that is final exam. Then all assessment, and then final exam. How many Vaivavos you face? You're always dreading the Vaivavos. When you go and sit in front of the senior examiner, your heart is racing fast. You don't know what he's going to ask. Then how I'm going to answer, how I'm going to impress, and how I'm going to get more marks out of this guy who doesn't want to give marks to me. And girls had a technique. When the question was asked, if they don't know, they start crying. The moment they start crying, they, ठीक है, रो मत बेटी, जाओ. We are not that fortunate. We boys are not fortunate. They will hack us if you cry. Salam, लड़का होके रोता है, ज्यादा सवाल पूछूंगा तुझे. तो मस्का मार रहा है मुझे. I will not leave you. So crying is not going to help you. It's not going to help you. So Vaivavos, always a challenge for us. Officers, they pass one Vaivavos, that's all in their life. And they act so great. You go to a bureaucrat, see how he treats you. A bureaucrat, he is not intelligent guy, he is a most average guy. Only one Vaivavos will face, that's all. And in that, one or two will clear, and that becomes an. Whereas you medicos, super intelligent brain, how many exams you take? NEET exam, that exam, 19 subjects, Vaivavos, you are much more intelligent than all the professionals. So, final Vaivavos you will have with whom? Not with your teachers, not with your parents, not with Prime Minister, President of India. You will have final Vaivavos with God. Why you should lead an ethical life? Why you should become a principal doctor? Because whatever you do in your life, ultimately, it is going to be between you and God. That's all. You and God. It is not between you and your patients. It's between you and God, because patients are God's creations. So whatever help you are going to do, it is between you and God. So this final Vaivavos, get ready, how it will go. I'll give my own example. Now, why ethical living? Because you're going to meet your maker and he's going to question you. Your ultimate Vaivavos is going to be with God. Can you pass this Vaivavos? You have passed so many Vaivavos, become doctor, postgraduates. Now, can you pass the Vaivavos which the God is going to take care of? What questions do you have in mind for me? Welcome to the dream interview with God. Now, God is going to interview you, not professors, HODs. Your God is sitting there last, final. So, I thought about myself, how I will face the Vaivavos. My final interview with God. I am dead. I'm entering. I don't know where I'm going, whether I'm going to heaven or hell, I don't know. But at the entrance, God is sitting. He says, welcome friend, welcome back to where you belong. You have come to your ultimate home. Now, I will ask you a few questions. Before I allow you inside. The Vaivavos starts. We'll ask you. Yes, my son. Tell me about your human journey. I was an orthopedic surgeon, sir. Good. Next. I was a very famous surgeon, sir. Good. Next. God is asking me, I'm answering. Sir, I replaced more than 5,000 knees during my lifetime. Good. Next. Fixed thousands of bones as an orthopedic surgeon. Good. Next. I did thousands of arthroscopy procedures, spine procedures, sir. Good. Next. I was office bearer of various professional bodies, sir. Good. Next. I made lots of money, sir. I earned. I became very rich. Very good. Next. I built a big home. Good. Next. I drove expensive cars. Good. Next. My children studied in school, sir. Good. Next. I built a big hospital, worked in big hospitals. Very good. Next. I had a huge bank balance, sir. Good. Next. I'm getting irritated. God is going on. Good next, good next, good next. What next? I did some social service in my free time, sir. Good. Next. I won many awards. Good. Next. That's all, God. What is that you expect from me? I did my best. I did everything. You are asking still good next, good next, next. Well, God, my son, very good. You have lived your life as per your standards in a very satisfying manners. But now peep down from heaven. Now you are with me and look down your fate below. See the earth now. From sitting with me, you see. Look what happens after you die. Your money is bloated by your kith and kin without even blinking an eyelid. You thought too much about before spending and saved for the family. Now the same family will not think twice before spending your मेरा बाप का पैसा उड़ाओ उड़ाओ मेरा बाप ने कमाया इतना ऑपरेशन किया मेरे लिए छोड़ गया उड़ाओ. So what did you achieve in life? Did you spend your life for all this? What is your final outcome? Your family and the world has forgotten you already. You are compulsorily remembered or not remembered on these 2 days only in your life. The two by your family. One is during your birth anniversary, they will remember and garland your photo. And death anniversary, they will remember my father or mother died and garland your photo. They will remember only 2 days in the year. Your colleagues have forgotten you. You shared a lot of beer with them, you hugged them, you did so many things, but they all forgotten you and they are leading their lives comfortably. Your hometown, state, country, world does not even know you that such a such person existed in this world. What does your obituary read? What is that which is written on obituary? What gift did you give to the world? You say you were a successful orthopedic surgeon. You used orthopedics to fulfill all your desires and needs. In return, what did you give to orthopedics? How did you enrich orthopedics? You became rich with orthopedics, right? What did you give to your society, state, country, and the world? These are questions that God is asking me. You only took, but you never gave. You never gave. Even if you gave a pittance. So this is what you are. What difference did you make to the world? Did you make any difference to the world? You manipulated your way to success, always felt that you lived a life of purpose. My son, you have wasted the precious gift of life I gave you. You could have done so many things, but ended up doing so little. I was shocked. This God is telling me I have not done anything. So much I did, so much of honor, respect I have got. God is telling you I wasted my life. Why? Then say, final remarks from God. How the teacher gives you the marks now. Final viva voce. The marks given. You wasted your life. That they live as if they will never die and die as though they had never lived. You have wasted your life. You could have done so much like these people. You could have done so much as a doctor, like Mahatma Gandhi or Mona Lisa, or you could have done so much. What is that you have done? Replaced joints, fixed bones. That's all, right? You could have lived for generations to come like these. The hypocrites, the Charka, Shushura. Like that, you could have lived for generations. No, you didn't. You could have made a difference in the world. Like all these great people. You lived the life of a beggar. You only took, you never gave. Tell me how your life is successful. Your life is not successful. The life was a gift which I gave you. You wasted it. So then somebody knocks on my head like this. Truth dawns on me. Arey haan na, maine kya kiya? Pura waste hi kar diya mera life. Then I'll say, sorry God, I'm so sorry. Please give me one more chance. I will now live the way you have told me to live. Send me back to earth. I'll start my life again. I'll make amends. God says, ये जिंदगी ना मिलेगी दोबारा. मैंने तेरे को एक चांस दिया, तूने गंवा दिया. बहुत लोगों ने तेरे को एडवाइस किया, तूने सुना? डॉक्टर जॉन ने बोला भाई माइक पकड़ के 1 घंटा लेक्चर दिया, तुमने सुना? टीचर्स ने बोला तुमने सुना, तेरे माँ बाप ने बोला तुमने सुना, बुक्स ने बोला सुना, कितना चांस था तेरे पास सुनने के लिए, और एक जिंदगी चाहिए, नहीं मिलेगा। चल तू आ गया वापस, अब तू चल अंदर, अब तू जहां जाएगा तेरा कर्म जैसा वैसा तू जाएगा। सो दैट्स व्हाट गॉड इज सेइंग। सो गेट इंस्पायर्ड माय डियर फ्रेंड्स, टेक टू एथिक्स or else you are doomed. Enjoy the journey of your life, not just becoming a doctor, not just passing MBBS. You enjoy the everything what you are now undergoing. Okay, for success, follow the process and not focus on the results. Was it a wrong decision? This dilemma always, this question I always, why did I become a doctor? My Hindi teacher, Tana master in my school days told, you should become an IAS officer, John. You don't go become a doctor. He said, why, sir? My dream is to be a doctor. No. You are having different skills. You are a orator, writer. So I think you become an IAS officer, you become very good IAS officer. No, sir, I want to become a doctor. So always I used to question myself, was it a wrong decision to be a doctor? You also ask your question, is it a wrong decision to be a doctor? There are so many medical colleges, so many doctors. So what about me? The answer is no. There is a great dearth of good doctors. There are many doctors, but good doctors hardly. And there are huge possibilities for you. In our profession today, you see what COVID did. And who was the leader? Who was the hero? It was the medical profession. So huge opportunities. People are waiting for you all with expectations like a Jesus is going to come, a Buddha is going to come, a Messiah is going to come. They are going to see no less than a God in you. This is the only profession. Nobody will see God in IAS officer. Nobody will see God in an engineer who built a dam. No, they will see in you. So yours is the only profession where you can influence. India needs more doctors. Only 6.1 per lakh is the seats available in the country for MBBS. So it is not farce. Our degrees, our course, still it makes sense in the present time to become a doctor because you have got chance to save. There is only one person on this earth, one profession on this earth whose life is not touched by a doctor. Only profession to have a privilege. He may be a rich guy, influential guy, he may be a king, queen, he may be a small beggar on the road. Everyone's life you will touch. At least thrice you will touch. Once, when the person is born, a doctor is required. When the person becomes sick, a doctor is required. When the person dies also, they require a doctor. Why? Because doctor has to certify death. Then only the crematorium and the burial ground will bury that person. So how influential you are. You are the only person who can touch the life of everyone in this 700 billion people in the world. You can touch their lives either during the life or at the time of birth, death, or during illness. You are such a powerful person. Inculcate value. Discover the diamond here inside, and then you see the difference, how you will become. So that was my path. Unconventional path, what I call as holistic journey. I went like that, academic, the social service, research and all. And I reached there, you also can reach. I chose my way. Was it the right way? Well, it is for you to decide. All roads lead to Rome. You will reach your goal ultimately, irrespective of what you choose. Provided you have the right values and the attitude, you will be successful. And don't forget this song. Muqaddar Ka Sikandar, Amitabh Bachchan's song. रोते हुए आते हैं सब, हंसता हुआ जो जाएगा, वो मुकद्दर का सिकंदर कहलाएगा. So do you want to be called as Muqaddar ka Sikandars? Then embrace the life of principles, ethics. Money will become the byproduct. Take it from me, you will become the richest man. You will get enough money and also enough duas, blessings. But if you chase money, you will get money, but you will be deprived of duas, blessings, principles. So my dear friends, thank you very much for inviting me here. Let me end. Hello. What people see, what people don't see. So most importantly, as you grow into this profession, take care of yourself. Do yoga, do meditation, do pranayam, and take to this combined principles of pragmatism, principles, ethics, not just money. So before I leave the stage, let me sing a song for you. Are you ready to listen?
Sir, I was just going to say that. Sir,
Okay.
here. I was just going to say that. Here. Sir.
Oh, okay.
I'm Dr. Prasad, Professor of Medicine.
Ah,
We want to hear you sing, sir.
okay. One song, a motivational song, which I used to motivate myself. There were no counselors for us then. Bollywood songs were the counselors for us. Okay, this song is from the movie Imtihan, a 1974 movie. Vinod Khanna, Tanuja, Kishore Kumar, Majur Sultanpuri, who wrote the lyrics, and Lakshmikant Parallel, who composed the music. That is apt for all. I think you should learn this song. You can sing all of this. कांटों पे चल के मिलेंगे साए बहार के, रुक जाना नहीं तू कहीं हार के, कांटों पे चल के मिलेंगे साए बहार के. Cannot sing orai.
All of you sing along with sir. Orahi, orahi.
See, sir is singing so well.
Orahi, orahi. Saathi.
ये तेरा इम्तिहान है, साथी न कारवां है. ये तेरा इम्तिहान है, यूं ही चला चल दिल के सहारे, करती है मंजिल तुझको इशारे, देख कहीं कोई रोक न ले तुझको पुकार के. ओ राही ओ राही ओ राही ओ राही. सूरज देख झुक गया है, तेरे आगे झुक गया है. सूरज देख रुक गया है, तेरे आगे झुक गया है. यूं ही I forgot the lyrics.
You ही चला.
यूं ही चला चल दिल के सहारे, करती है मंजिल तुझको इशारे, देख कहीं कोई रोक नहीं ले तुझको पुकारे. ओ राही ओ राही ओ राही ओ राही, रुक जाना नहीं तू कहीं हार के, चल के मिलेंगे साए बहार के. Like that, you also, when you walk on this path, always keep your hope. You will become one good doctor. I am hoping that out of 200 people here, there is one Padma Award sitting here, or more than one Padma Award sitting in this audience. And I will get to listen to what she is the one who taught me all these principles, which I've shared with you today. Thank you, my mother.
My dear students, I think we are spellbound after listening to sir for last. All of you should get up and give a loud standing ovation. Louder. Thank you. Thank you very much. Thank you very much. Please sit down. Sir, when Harsh told me that Johnson was going to talk and he's an orthopedic surgeon, so I was just wondering what could be the talk. And in the list of the speakers, the topic was not mentioned. So I kept asking him, what is sir going to speak? But I'll tell you, this has been the most inspirational talks. And I think, Harsh, your Medalium is already a success because, as sir said, me too as a teacher would dream that one of you will be in the Rashtrapati Bhavan someday. You may not become the President of India, but you will definitely win an award and go there. Thank you very much, sir. It is indeed a great honor. Throughout, when I saw sir's presentation and he showed that he was singing with madam, actually I was tempted to tell you in the end to sing. But sir, you have fulfilled that desire of us also. So indeed, we are very happy to have you here. I hand over the mic now to the conductors of this program. I request Sirangan ma'am, the organizing secretary professor, to felicitate sir.
We are really very privileged to have a multifaceted speaker like you, sir.
Amen.
For 1.5 hours. So much of patience you people showed, and not a single student got up and went out. And I should give a big applause for you for listening me for 1.5 hours. Thank you, students. Thank you, friends. Thank you, sir. Thank you, madam. Thank you, Harsh. Thank you, Dev. Very Sanskriti, who took such good care of me since yesterday. Thank you all. I really remembered my MBBS days, and it was great privilege to be a part of this Medalium, which is a unique concept. Because conference workshop for undergraduates is definitely required, but next time add life skills. Thank you. Thank you, madam. Thank you.
I would like you all to remember one thing what sir said, that you all are diamonds, you are gems. What we are doing as teachers is only trying to polish. Okay. So with that, Harsh, thank you.
The medical life can become draining and dull, especially for students who do not have a direction. Sir, you have inspired us to go in the right direction required to combat stress and the troubles that come our way. Thank you for mentoring us on how to approach common problems in new, innovative ways. Thank you, sir, for guiding us on how to make a difference in this world. We will definitely aim to mold ourselves into the greatest doctors we can be.
Padma Shri, Dr. John Abanza sir has accomplished milestones that most of us only dream of. His accolades are endless and still counting. We feel extremely privileged to have face-to-face live interaction with such phenomenal and dynamic personality. Thank you so much, sir, for enlightening us with your words. We will try our best to walk on the path of success while taking care of ourselves and always pushing forward to widen our horizons. Thank you, sir.
Harsh, lunchtime?
I request everyone to remain seated till further instructions are given.
Guys, please proceed to lunch and try to make it quick. We need to be here back by 2 to max 2:15. Thank you, everyone.